Pleasant morning, everyone, and welcome to this final day of our special program, the closing ceremony for the University of the West Indies EU in Alternative Justice Initiative. Yes, the University of the West Indies has embarked on this project for 24 months, and the EU has been a part of the funding, and the Department of Government, Institute of Caribbean Studies are part of this, along with Equal Rights and Justice for All. Today we have a good outline of people to speak with you, those who are indeed professionals in their field, and going along the line, there are many people here that I'm seeing, and I just like this lineup. I don't know, I have Dr. Olivine Burke that will be with you really shortly. I'll give her a better introduction a little later on. You have Miss Nicola Sachel, we have Mrs. Carol Watson Williams, Miss Terry Ranglin, Mr. Burchell James, Miss Kevel Campbell, Miss Vivette Miller, and based on these presentations and based on the panel discussion we'll have a little later, I hope you learn a lot and understand what it is this Alternative Justice Initiative ought to bring to you. So right following this introduction, I'm your moderator, Sondre Roden, and I'm here with you to introduce who will come to you right now, and it's Dr. Olivine Burke. Dr. Burke, she is a lecturer and also the executive director of the Mona Social Services. Yes, I interviewed Dr. Burke on News Talk 93 a couple weeks ago, actually. I don't know if she remembers, but she told us about the many initiatives that she has done and the different projects that she'd be a part of in specifically the August. Now, Dr. Burke is going to come and she's going to talk to us on the use of restorative justice centers at the community level. And that's her study, her area of expertise. So lend her your ears. Dr. Burke.
Thank you, Sanjay. Good morning, everybody. It's my pleasure to speak with you today on one aspect of a bigger study that we have been doing over time. And as Andre says, I'll be looking at the use of justice centers at the community level. And in so doing, I need to mention that what I had basically done was review 5 justice centers as a pilot in order to determine what they do in general and the extent to which they serve the communities. But in order to do that, I also had to basically do more or less an audit, if you may, of these justice centers. So in my outline, I will be giving you a brief background. I will share with you the problems that the justice centers have faced, the objectives of the study, the methodology that we used, the findings, discussion, and conclusion. Now, reasons for high rate of crime and violence. For many years, Jamaica has been referred to, as you all know, as one of the highest homicide rates, having one of the highest homicide rates in the world. Jamaica has been comparable to many of the countries within Central America, the Central American belt. Now, this phenomenon of the crime and violence is led by guns, gang violence, and organized crime throughout the country. The impact of this trend result in high, huge costs affecting national security as well as health, and indeed it has also affected the justice system. What are the reasons for the high crime rate? Jamaica is among the top 5 countries in the world with the highest homicide rate per capita. And we know that police officers are frequently unable to make arrests in communities due to myriad of constraints, density of population, poor roads, lots of zinc fences, pathways, all of those things. And of course, indeed, community persons more or less being very, very protective of persons within the community, despite the fact that they may be involved, yes, in the crime and violence. Now, courts have been able to convict just about 7% of homicide cases. And again, we know that in many cases, witnesses are not around. They do not show up, and as a result of that, many of the cases have not been able to close. Authors of the Crime and Safety Report have noted, and I quote, "The public and police doubt the effectiveness of the criminal justice system, leading to vigilantism, which exasperates the cycle of crime and violence." Court cases which have overwhelmed the security forces and the justice system continue to lag behind. And of course, inefficiencies in handling the case matters have also helped in the backlog of cases. The backlog of cases, I must say, are due to, among other things, the very long processing time for cases to start, as well as, and as a result of that, victims have been losing confidence in the justice system. So what's the context for the restorative justice? It was against the background that there was the need to re-establish control over the justice system and also some amount of confidence of people in using this justice system. And so they also wanted to make this justice system, the use of it, affordable and within the reach of persons who really need to access this kind of service. And when I talk about the persons who need to access this service, I'm really talking about many persons from what we would call the inner city communities, the under-resourced communities, underserved communities. And you know, typically these communities have very low socioeconomic viability, and persons live more or less below the poverty line. So they wanted to find a way to have these persons able to access the justice system, so at the end of the day, we can all have what we call justice for all. Now, what was the goal of the restorative justice system that was set up? First and foremost, and we would have heard some of this yesterday as we went through the day's event, the restorative justice, the goal of it was never ever to punish the offender or to alienate the victim. The goal was more or less to ensure that both parties, victim and perpetrator, can mend their relationship, the broken relationship that is, and move on with their lives. So what was it? What is the objective really of the study? It was to review and analyze the use of the restorative justice in 5 centers across Jamaica. And from that review, we were now to use the information to inform policy guidelines for the implementation of restorative justice within the Ministry of Justice. What's the methodology that we used? First of all, as qualitative researchers, and quantitative would too, we did an extensive desk review. That desk review of the literature, we used it to more or less help in identifying and forming the questions that we used in the interviews that we did with the Justice Center managers. So we identified the cases in collaboration with the Ministry of Justice, and we did purposive sampling of the centers, because it was purposive because, of course, we had identified the centers that we would be using. And then we went through the data collection. We actually interviewed 5 center managers, and it's more than an interview. It is more like a discussion, if you may, that we had. And after interviewing the persons, then we went on to code the wealth of data that we gathered. We coded them, came up with thematic areas, which we then analyzed and presented the findings. Now, in terms of the findings, we did those in terms of themes. And the themes that we identified, the most prominent themes coming out of the wealth of information, were client use, staffing, resources, stakeholder relationship, and we also did a SCOT analysis looking at the strengths, the challenges, the opportunities and threats that these centers would face, and then we presented some recommendations. Now, what were the findings in terms of the staff? First of all centers had 2 or 3 full-time staff and 1 or 2 part-time staff. And you may be asking the question, why am I doing this when we're looking at the use of the justice centers? Well, in order to determine the extent to which the services were being used and also the efficiency and the quality of the service, you had to look into the background of the centers to see whether or not they had the capacity to undertake the kind of services that they would need to do with all of these persons who depended on them. And so, as I indicated, all the centers had like 2 full-time staff. Those full-time staff included the center manager or administrator, and also the community liaison, and of course, sometimes the cleaning person, which was the attendant. That person was the part-time person, in addition to some volunteers that you had at the center. Of course, later down you will hear that those volunteers reduced after I think it was about March last year. So community members also acted as facilitators and assigned to assist with victim and offending victims and offenders while they're doing their conferences. Another thing we found in relation to the staff was that the facilitators were unpaid people. What they did, they received some stipend to cover like transportation and little refreshment. Interestingly, the stipend was discontinued, and as a result, there was a significant reduction in the interest of facilitators to continue providing this service. Now, the point I'm making is that the facilitators were largely volunteers. These persons received a stipend, but early in the year, that stipend was discontinued, and that had some effect on the availability of these persons to undertake the number of cases that the justice centers had to deal with. In terms of speaking using the voice of one of the persons. There are no volunteers that are here active at this time in the program, as a stipend has been removed from the program as of March 31. And so with that, it is one of the weaknesses or constraints in providing restorative justice service to the extent that we would want to. For the centers, there are only 2 persons employed here, which is very insufficient. Myself and the liaison officer and a 2-day work attendant. So this is what was said by, I have here respondent to, but in most cases, this is the general thing that was coming from the center managers. Now we look at the staff, the duties, and their duration. The center managers were there, they have been employed between 1 and 7 years at the center, and their duties involved providing strategic direction for this center and supervise the staff as well as the volunteers. They assisted in facilitating conferences, and they did that more so especially after there was the reduction in the facilitation volunteerism that was there. They also assist with preparing final court reports and the general administrative duties. They do all of that and had responsibility for the general oversight of the centers. The community liaison officer, their responsibility was largely to facilitate the conferences. So the center manager assists with it to the extent that they were called upon to do so, especially after the voluntary services were reduced, as I indicated. So the main job of the community liaison officer was to facilitate the conference along with some JPs and other community persons, keep records, write the reports, and also facilitate the client-partner relations. Where the volunteers are concerned, they assist with the center, with conferences as a community member. Now we look at the extent to which the centers were used and the distance between the persons who have to access the center, where they're coming from to get to the center. So most of the centers serve between 6 and 50 cases, right? And when I say 6 and 50 cases, at the same time you're looking at populations ranging from 1,000 persons to over 14,000 persons. So just try and process one center manager, volunteer, one center manager, one liaison, and some volunteers to serve all of those the wealth of that population of persons. Now we also saw that the average distance between where the persons are coming from to reach to the justice center range from 6 kilometers to 50 kilometers, and you find that in the rural parishes, the distance to get to the justice center is farther. Now, those who reach within 6 kilometers, they are persons who would be residing more or less within the communities themselves. But what we also found was that in many instances, residents preferred not to use the justice center that was closest to them. And there were many reasons for that, some being confidentiality, trust, etc. Community clients accessing the center From the research, we discover that only like around about 6% of the persons who utilize the nearest center. They prefer, some persons are not comfortable going, as I indicated, they prefer to access another center that was within another local parish or so that they could also get service from. But at the same time, even though, say for example, let me use Augustown for example, they may not readily utilize the justice center which was located at the source. But at the same time, they would go to another justice center, perhaps in Spanish Town or so, to access the service, because of course these persons are unable to afford what it really costs to take. Some of the matters are simple matters through the court system. The centers, in terms of the number of conferences that they do per week, range from 5 to 8 conferences per week. Now, you may look at 5 to 8 and say, well, 5 to 8, that's not too bad, because it's one center. I mean, for the center manager and the liaison. But when you take into consideration that the conference lasts between 3 to 6 hours, depending on the nature of the issue that was brought to them, there is no way that the center managers could really manage more than that, and also to do it with the quality and interrogating and ensuring that at the end of the day they follow due procedures and due process, so that both client and perpetrator, not client and perpetrator, both victim and perpetrator feel confident that they have, that justice have been served, and that they are comfortable with the outcome. The number of weeks to complete the case may range from 2 weeks for simple cases to an average of 9 weeks, but in most instances it takes under a year. Now, think of the justice center as against the court. We know that cases in the court may take many years, no matter how simple it is, because again, within the court system, you're looking at backlogs, yes? And so the simple case may not come up for hearing for a long while. And of course, they also do follow-up. Follow-up is something that is only done in the justice center. That's not done in the court. Case done, case done. There is no follow-up. Follow-up can take an average of 2 to 3 months, depending on the agreed restorative activity. Within that scheme of things, depending on how the entire thing was unfolded, persons may have to pay to clients for damages, depending on what was the agreement, and or they may agree to conduct some act of service among others. Because again, remember that we're talking about people with very little resources, and so they can come from an amicable solution can be found, yes, then it doesn't matter the kind of payback, as long as it is an agreement between them. That kind of negotiation per se, you do not have it. Those persons do not get it to that extent within the formal court system. Now, what does the conference or the normal workflow within the centers, what do they, what does it look like? First of all, cases are not sent to the centers like prior to, like in the early establishment of the centers. Center managers have to actually now visit the court in order to negotiate with court personnel for cases to be referred to the center. Once they get the cases, the clients are then ordered by the court to attend the conferences. For those of you who are out there and you may not be familiar with the term conference, it's just the dialogue between the persons. The victim and the offender are interviewed separately. And then once they have been interviewed, an agreement is sought to move forward to the RJ process. So even though the cases may have been referred, at the same time, the parties have to agree that they would want to undertake the restorative justice process. That is clearly, the process is outlined to them, and then both clients are invited to attend the conference. The process continues until a solution is found. Now bear in mind that I indicated earlier that the duration of the process varies. Once the process has been completed, the report is written and presented to court, right? Of course, it is not all of them that is presented again, because based on the nature, or it is filed and put away. The same procedure is used in conducting the RJ process for all the cases. We have where some clients are also found during, so in addition to the fact that clients are referred by the court, some clients are found through community outreach. You may be within the community attending some form of initiative or event or activity, and persons are referred from there to the RJ process. To the RJ center to undertake the process. And of course, from time to time, the centers do also get walk-ins, right? So you had 3 ways of the center serving the public: through the court system, referrals, or just within the community outreach. What is the level of client satisfaction? From all indications, the satisfaction has been positive. Now I know that coming out of the research yesterday, some persons indicated, I think it was the lawyer, was also talking about the level of satisfaction, and he did not bring out, from what I can recall, that it was largely positive. But from this data collection, utilizing the information from the center managers, the level of client satisfaction was positive. And how did they measure that level of satisfaction? They actually did exit survey. So they do have a monitoring and an evaluation element of it, because the ultimate objective is to, 1, satisfy the clients, and also to ensure that the due process is done and expedited, but at the same time with all the protocols being observed. And so clients' reaction to the RJ process, according to one person, most clients who complete the process had positive reviews. They expressed an appreciation for the process. However, from our account, the managers believe more could be done with regard to further healing for clients, such as counseling, while they do the counseling within, during the process, they do not do much follow-up in the communities afterwards. They do some amount of follow-up, but again, two full-time staff. What level? You can imagine the level of follow-up that they could actually do. So they are not totally satisfied with that aspect of it, and they make recommendations to be. The managers believe more could be done with regard to further healing for the client, such as the counseling, as I indicated, as the center can make recommendations, but they cannot actually force persons to implement them. Of course, there was no information on the extent of repeat offenders who were introduced into their communities after completing the process. And why was there no information? Because again, the limited staff does not allow for that extent of work. Center staff only interacted with persons who are involved in matters that are brought to the center. And there are currently no mechanism to address repeated offenders' situation if that should become necessary. So if there is a repeat, it would have to go back through the system, yes? In terms of the resource, what was the findings of the resource? First of all, there was no standardization across the centers, yeah? Most of them, though, they were small in size. They had a general office and a conference room space. So, some of the centers were much better off than others. In some, there was no waiting area to separate victim from offenders. So again, if there's no waiting area and these two persons are at quote-unquote loggerheads with each other, they're not going to be coming, right? And so that reduces the amount of cases that the centers would serve. There was also no separate in terms of just general facilities, bathroom facilities and stuff. Clients, in some of the centers, clients and staff utilize the same area. And of course, there was no lunch area for staff. So those kinds of inconveniences, even though persons may not be economically up there, you know, their status is below many. At the same time, they know that there are just some things that they would want to look for in order that they can have the confidence in the center. So one respondent said that we need to have specific offices and a conference room to host the conferences and pre-meetings, as well as a waiting area. It's basically one big large room that we have. We have to improvise where when we improvise, we use cabinets to section off an area, but you could say it's really not private. Now, can you imagine victim and perpetrator, and the place, the facility, the room is divided by just a cabinet? Hello, who is going to be there? Who is going to be going there? We need some amount of privacy in order that you can talk. And of course, you know, remember that when these persons go, sometimes they are angry. The first person you don't want to see is a person that you have some form of beef issue with, as the case may be. The resources, continuing on the inadequacy of the resources: printer, ink, phone, card, cellular phone, security systems were some of the security or insecurity in the system were some of the other inadequacies that we found. Like, for example, it was just October, I believe, we received ink in our printer, And that has been without ink for like 8 months. Now, when that happens, it is really challenging. We have nothing to print, whatever agreements we would have come up with. In terms of forms, we have nothing to copy documents for persons who come in. And sometimes we even have to go out and beg and see what we can do in order that we can serve our clients. Believe it or not, our clients see those things, they feel it, and they know it. And so the confidence level has been falling. Now, the Justice Center work along with a group of stakeholders. You know, they built a client relationship. Some of the stakeholders they work with, you have heard me mention from time to time the court. They also work along with the Jamaica Consolidating Force, the Victim Support Unit. They work along with Justice of the Peace, Correctional Services, the Ministry of Education, the community-based organizations in the community, as well as schools. And this has not exhausted the list of stakeholders that they work with, because they also work with a number of NGOs. From one particular center manager, she indicated that the center receives cases from all over the parish. The average distance from the farthest point to the center is approximately 16 kilometers. However, some clients travel over a distance of 20 kilometers and beyond. That is in terms of the clients. Now, in terms of the stakeholder, the partner, the court, the Jamaica Consolidating Force, and the schools, as I indicated, are partners. The center receives most of its partners from the parish court, and staff members visit the court to get the cases. Now, what are some of the strengths and what we found from the SWOT analysis? There were a number of strengths for the restorative justice centers, yes? Among the strengths are, one, it is victim focused. Victims get a chance to be heard and provided with services to heal. So that is comforting for the victim. They get a chance to be heard and to be provided with services to heal. I will skip to the next slide as I go through some of the strengths and some of the strengths, because I did not put the challenges, opportunities, and threats running concurrently across the page. So another strength is that the center is designated to keep citizens outside of the formal justice system. Restorative justice is designed, to keep citizens outside of the formal justice systems. Offices within close proximity to community. The process is more affordable to citizens in relation to that of the court. It provides space for healing and also restoration and compensation. When I say space, it means that, you know, you have a chance to talk about, to cry, to understand why the person did this. You know, a clear understanding that kind of space, that kind of opportunity is not provided in the court system. And so they appreciate that. And that is a strength that the restorative justice centers bring. There is also clients who go through the process. Clients who go through the process, they do not get a criminal record. What are some of the challenges? And this is the source, the sore point that the centers are having. There's current demand. The current demand is higher than available human resources. You can recall the number of cases presented, 2 full-time persons, reduced number of volunteers. some community members may not be receptive to use the RJ approach, because as much as it provides the opportunity to dialogue, yes, discuss and find out why this happened, why did you do this, and you speak it out in order to agree with it. Some persons don't want to use that. They prefer to go through the court system because they feel, I guess, more confidence in that system. Community members do not want to venture to the center due to distance and fear of traversing outside of the community. And also another challenge is they may not be appropriate for intimate. The center, how it is set up, may not be appropriate for intimate partner violence. Let me skip over to some of the opportunities. Persons find the setting in opportunities, additional staff. All of this provides the opportunity for us to re-examine the staffing and to understand that additional staff need to be hired for the program in order for the service, in order for them to be able to serve the communities as they should. Additional budgetary allotment for the program will make the agencies, the centers, far more relevant. The program to be expanded to other areas within the parishes, because again, because of how far they have to travel in some instances, if we could establish other centers closer, because if you're talking about persons with the inability to afford certain things, then you would also be looking at the inability to find that extra money to pay transportation costs. And yesterday on the panel, when they were talking about the abuse in the homes with the women and the children, one of the reasons they do not go to find that resolve is the inability to afford the next step, maybe in terms of transportation. Then you find another opportunity, or we're going over to the threats. One of the threats, and there are many threats to the continuation, the successful continuation of this, is the withdrawal of the international donor funding. And we have seen the effect of that, because it is as a result of that why there was the significant reduction in stipend and other things that international donor funding would have provided. Another threat is the change in the direction or strategy by the Ministry of Justice. That is another threat, as well as a reduction in budgetary allocation will again significantly affect the quality and the type of services and the number of persons who would have been able to serve. Also, community apathy and gang violence in communities, because what you find is that some persons are not able to come out because of the constant recurrence of gang violence. Also, to move from one section of a community to get to the restorative justice center where it is located, you may just have to pass through another section of the community which is at war with your section at a point, and so again they are unable to access the service. So by way, I'm not sure how I'm doing in terms of time, however, by way of conclusion, because I know that there are questions that are coming up, the conclusions that we have drawn are that the restorative justice program, we know that it was introduced to address some underlying crime and violence issues, as well as to reduce case backlog and repeated offenders. We conclude also that some centers have been successfully achieving this goal despite the many inadequacies, staffing, resources, etc. The findings have provided lessons to improve the services to those who need it and to reduce cases that can be otherwise resolved. When you examine the findings, it provides a lesson for improvement, and both in terms of the service and in terms of reduction in case backlog. And finally, the subsequent recommendations are designed to inform policy framework for further development. Now, we presented some recommendations to inform policy, and some of those recommendations include that the restorative justice under the Ministry of Justice should be clearly defined. That is, restorative justice now under the ministry, operating under the Ministry of Justice, should be clearly defined, given that more or less some of the features would have changed since they are operating there. The goal of the restorative justice would also need to be clearly stated. Yes? In the policy framework, you would therefore need to look at defining restorative justice center, looking at the goal of the restorative justice in general, the goal of the system, the functions of RJ and the center, the financing of the center, programs and activities, access to restorative justice and the center services, how you access the program, the activities, the governance and management, which include adequate staff and qualifications, etc. The infrastructure, including the security, which was a concern. Some centers didn't feel that they were secure enough even when they are providing such service, because they have no way of indicating if they were faced with any challenges within the space, considering that they have to serve clients of different kinds of background. There was also need, within the policy framework, you would also need to clearly outline the public relations and marketing, because what you found is that within the last couple of, may I say, years, well, there's not been much marketing and public relations done anymore, and some of the signages, billboards, etc. is now invisible, no longer visible. So you need to set some guidelines as to how we are going to market the restorative justice and the center and the services that are provided. And that has to be clearly outlined, as I said, in the policy, as well as the relationships, the collaborative relationships that we will, how they will go about building on that network of relationships that are forged. And of course, there are some recommendations of how all of that could be outlined. But given time, I now just say thank you for listening, and also to thank the persons who have assisted in putting and providing this information, Ms. Harris, Ms. Richards, and Mr. James. Thank you.
All right, thank you so much, Dr. Olivine Burke. She is the director of the Mona Social Services. She is also very much involved as it relates to this research in restorative justice centers. And we have some questions for you, Dr. Burke, and I'm just going to ask and see as best as possible how you can answer these questions. Personally, for me, I sat there and I was thinking to myself, the first question that I have for you is as it relates to the volunteers. Now, seeing that it's a case where funding, it's a huge problem as it relates to volunteers, how then can the government under the Ministry of Justice find a way to implement persons, whether unpaid volunteers, how is it can they implement these persons in these centers to make it more effective so that the citizens can actually get the benefit of these centers?
Okay. Well, first of all, I mentioned the public relations and marketing. In establishing this campaign, where you are rolling out to say these are the persons and the characteristics or profile of the persons who we would be seeking to volunteer their service as part of their civic responsibilities within our country, then persons may be interested. Additionally, working with the community-based organizations, going into the schools, and the ministry doesn't have to do it themselves, because there are a number of NGOs working in these communities. So if you establish that kind of relationship with these NGOs and work through them, also the various community-based organizations that are there, work again through them, you would be able to build that list of volunteers without having to think about money to pay them, because there are so many persons out there who want to give off their service to the country, because at the end of the day they are looking at reducing crime and violence, which would be to the benefit of absolutely all of us.
All right, so just another question real quickly. Do you think there are enough restorative justice centers locally to help with the simple problems that we don't want to bring to the courts, as it were?
Yes. Yes, there are restorative justice centers all across the country, more than enough. However, having the centers and not having all the resources, human resource and otherwise, to serve the populace, then the number of centers become redundant. Because it's not about the number of centers, it's about having the infrastructure and persons in these centers to serve the people.
Right, so on the same point of resources, we know how you were telling us about how the buildings were, and there was a significant problem as it relates to the space. So if you have, you said, a offender or a victim, and you have the perpetrator, you have the person who is the victim, they're in the same space.
Yes.
And that has a huge problem. So how does this in effect affect how it is that we can have more results from restorative justice?
Well, if we were to provide the kind of space, in other words, one of the recommendations that was made from the center manager is that there are separate areas within, distinct areas that are built with privacy. When I say built with privacy, not separated by a file cabinet per se,
right,
but separate sections, so that when you have conferences, persons can know and feel that their issue is within the walls of the center and not within the walls of the center and not being exposed everywhere when they are making their case, the victim or the perpetrator, they are not hearing each other at the same time until it reaches a process where they are to come together. So what I'm saying is they need enough space where you can have like a conference room, separate totally and clearly demarcated from the office for the staff, or the lunch area, that kind of thing. You can't have one big room to one big space, one large space to conduct all of that kind of business. Once you have this demarcation, then we should be getting at providing wider service for more people. In addition, as I said, you must have the number of human resources and also the other basic stationery and equipment to do the job well.
Right. So are restorative justice centers spaces for family members per se that have problems?
Oh yes, because a lot of the restorative justice it wasn't designed for hard core cases. It's more, family, intimate partner, those kinds of smaller, lesser degree cases, not the hardcore. So yes, they provide that for family as well as individuals.
Right. So I think I have just a few more questions for you. So currently, thinking about it, you mentioned the backlog of cases, as it were, in our court system in overall. And restorative justice centers would look at, as you said, the managers now have to go to the courts. They have to say, these are the cases that we can take on, and we can ensure that these cases get sorted out in a way that would be really quick, really clean, that the people get the justice they deserve. But do you think, based on your research, that if it is that the centers are funded effectively and the managers have the resources, that it can help with the backlog of cases that we have in our courts in Jamaica?
Well, it is not only that do I think it can help, it has been helping over the years. If we did not have the restorative justice centers, we would not have been at the place where we are today, where so many cases have been resolved amicably through the restorative justice system, as well as utilizing the other kinds of alternative dispute resolution systems. Yesterday they talked about like the mediation. It's also part of the justice system, the restorative justice system, the counseling, the guidance, all of those. You don't do those things, the court don't have any space for that. And so many cases have been resolved. I do not have the figure in order to make it a little more scientifically prudent,
yeah.
Yes, but that is for another research.
Yeah.
So yes,
Right.
But yes, indeed.
All right, so my final question is just an understanding. Could you give us an understanding of the relationship between restorative justice centers and the Department of Correctional Services?
The relationship. Okay, the Department of Correctional Services would refer cases to the Restorative Justice Center.
Right.
So that's the kind of relationship. And so once the case is referred, then it goes through the process of contacting, the victim, understanding what it is about, the perpetrator as well, and for them to agree to come to the Justice Center in order to, go through the process to have their case resolved amicably. There may be some fines, we don't know, but if that is it, because sometimes, some things happen, all the persons want is just for you to pay them back for maybe damaging something, and once you agree, that's it. But if the platform was not provided for that kind of discussion, then it would
Right.
drag on for years in the court system.
All right. Thank you so much, Dr. Burke. You know, Dr. Burke gave us our first presentation this morning, and we have other presentations coming right now going on. But I can say I really learned a lot from that presentation specifically. I understood all the different areas that there needs improvement in this specific restorative justice system as it relates to getting equality and justice for all people in Jamaica. It seems that if somebody owes me some money, I might need to go to one of these centers. So right now we're going to take 5 minutes. We're going to take 5 minutes. We're going to take a 5 minutes break while you figure out how it is you can get back some of the petty cash that somebody owes you at one of these centers. We're going to take a 5 minutes break, and then we'll go to our next presentation, and I will introduce that person to you when we are back. So we're going for a break. Alternative Justice Initiative. Yes, it's a collaboration between the University of the West Indies through the Department of Government, the Institute of Caribbean Studies, and this is for an Equal Rights and Justice for All initiative. Yes, at this juncture, I'm here with you. I'm moderating with you today. I'm Sondre Roden, and we're going to go on into another presentation. Earlier, we had Dr. Olivine Burke. She spoke to us on the use of restorative justice centers at the community level. Now we're going to continue, and we have another presentation right away. We have Miss Nicola Sachel. She's a community safety and security specialist. Her presentation will be on the community justice framework specific to the lived realities of the communities served by security and justice practitioners. So Miss Nicola, she has a lot of experience in this area. She's a specialist, and she'll be speaking with you now. So keep listening, keep in tune, and I hope you understand and learn a lot from her presentation. Miss Nicola Sachel, I hand over to you.
Good morning, everyone. It's a pleasure for me to be presenting today at this very important conference. And I will be focusing on the community framework, which was a part of the Justice Initiative. So we have hearing a lot about the restorative justice mediation and its importance in carrying out not only case reduction in our courts, but also potential that it has for community justice. And this is the focus of the presentation today. And because this is a macro level process, the framework or the justification for this kind of framework is coming from the National Development Plan 2020, which speaks to or getting to the place where we have a society that is cohesive and just, and particularly that National Outcome 6 that seeks to promote effective governance vis-a-vis the improvement of access to justice services in the courts, the justice centers, the mobile units, and the implementation of restorative justice practices and strengthening mechanism for dispute resolution. So we have heard already from the presentations yesterday and today that the framework of alternative justice in Jamaica has largely been driven by that justice reform agenda that seeks to promote the efficiency of our court system through case diversion. But one of the things that is also within the spirit of the legislation and the different policies that have been promulgated is that capacity to generate and enhance the rule of law by confronting the culture of violence in Jamaica. And we have seen over the years that there is tremendous success articulated on how the alternative justice mechanisms have helped us in reducing court backlogs. And another component that is not readily promoted is this capacity to build mechanisms for social control at the community level and to help develop more efficient and effective problem solving within communities. So we believe that this is a moment where we can consolidate those lessons learned and articulate a community justice framework that is focused on peace building and community development. So, as a background, to this also is that the restorative justice policy, and this is a part of the alternative justice framework, speaks specifically to processes, building processes that help to build social capital, empower citizens to collectively resolve problems more easily, allow communities to advance smoothly in harmony, fostering increased confidence in everyday business and social transactions, and improve citizens' circumstances by sharpening their awareness of the many ways in which their faith is linked to instilling more tolerance, less cynicism, and more apathy towards the circumstances of others. So we're thinking here about building neutrality, building trust. So we're shifting the focus from the overall justice approach to a community approach that really is built on the capacity of the entire community and its stakeholders to not only respond to crime, but to develop proactive measures designed for crime prevention. So we know historically that Jamaica has used repressive tactics to manage its crime problem. And so we're focused now on what it is that we can do to create more social controls at the community level. So let me tell you a little bit about the methodology that informed the development of this framework. So the data that has been utilized it was garnered from the national baseline data set, and Dr. Gavin Daly presented on that yesterday and gave us an overall feedback on or presentation on the findings. The interview conducted with stakeholders from the restorative justice centers that Dr. Burke just gave us a very interesting presentation on. Information from research on the whole child justice in Jamaica, secondary data, including the legislative review and other relevant academic and pragmatic texts, not just locally, but regionally and internationally. So some of the opportunities that we see in developing this framework, as Dr. Daly presented yesterday, that we see that there is much willingness from identified by both victims and perpetrators, offenders, to participate in alternative justice. And as you've been hearing from Dr. Daly yesterday, that we also looked at the potential of including legal aid. So now a lot of the focus on legal aid is on criminal justice intervention, but we also think that there's a civic component that is also important, and there are myriads of possibilities that exist there. So that we see as a basic opportunity that Jamaicans are willing to participate in alternative justice. And also that when we looked at the type of disputes that Jamaicans thought could be used to, could be resolved through alternative justice, that it was not just focused on contractual matters, as was said, like issues with contractual breach of contract, family matters, but also that they thought that also has the potential to deal with gang violence, verbal assaults, theft, domestic violence. So there are a wide range of issues that Jamaicans believe are possible to be resolved through restorative justice. So we see this as a very important opportunity. What are some of the threats, though? And the threats that we have identified is that communities are exposed to significant crime control initiatives. So we have the states of emergency, we have the zones of special operations, and this, of course, is another model to social control that impedes the capacity for the use of alternative justice. The subculture of violence, and some have said it's a culture of violence in some of these communities. So there is that tendency to use self-help violence. So when something happens, people tend to resolve through violence. And also the inform of a dead culture, that code of silence. So when something done, it is like if you go for assistance, if you go for help, that is seen as you are being an informant. So these are threats that we have to confront. The also the community fragmentation, and Dr. Burke just spoke to this, where you have these community boundaries. So community members find it difficult to traverse their communities comfortably. So she spoke about, for example, the justice center being in a particular part of the community, and persons from different sections find it difficult to get to where the centers are located. So definitely the community fragmentation is a threat. And of course, we know that the greatest external internal threat that we're seeing today is COVID-19, and how that has really restricted our capacity to move about as we used to. So looking at those, we have to think about how we can develop this framework while having the considerations. So, in building the framework, what we wanted was to have a flexible model that allows for the adaptation of the modalities and legislative changes, but also that is focused on the social control and enhancing crime control, with a focus on interpersonal and family and community violence. So uh, yes. So let's go to the model, and we can talk a bit about how we have thought through this. So first, we believe that the it's important to have the Ministry of Justice, the main policy directorate, really anchoring this model. We might be saying it's a community justice approach, so it should focus on the community. So while we're saying yes, we want this community focus, we're not circumventing the national structures that are there for checks and balances, and to ensure that there are effective policies and programs that are driving use of alternative justice in Jamaica. So there's also the Ministry of Justice, the Restorative Justice Unit, and of course, this is important in articulating policies again, and they are really that mediator between the community and the ministry, and they have a central role in monitoring and evaluation, and also in ensuring that we are implementing alternative justice models in an effective. So there are these restorative justice centers and these parish justice centers, and more we're seeing that the government is articulating these centers as a hub for alternative justice and also for child diversion. And we believe that this is an opportunity to have this centralized hub where community justice can take place through this one center that is carrying out all of these particular activities. So, in looking at this, and Dr. Burke spoke about the resource challenges that these centers are having, but if it is that we're going to have an effective community justice ADR model, then these resources, these centers need to be equipped with not only the tools for carrying out the ADR, but also the capacity to interface with the community. So, as Dr. Burke outlined earlier, that most of the cases that that are dealt with at the centers are really referrals from the courts. But there are these institutions within the communities that there are potential in implementing restorative justice, mediation, and other alternative dispute mechanisms. And so we are saying we are articulating that there needs to be that imagination that allows for the understanding of the community dynamics, and that center managers are able to articulate their goals and objectives based on the need of the community. So yes, they're doing this top down based on what the legislation and policy are demanding, but also an understanding of what is happening in the community. And so this should coalesce at the Justice Center. So in this, we're saying that center managers should be equipped with the capacity to do situational analysis, to do problem analyses, to be able to identify the main institutions within the community, to be able to identify who are the key stakeholders, to be able to identify hotspots of interpersonal violence, looking at the schools, looking at the hospitals, looking at the different places that I'll talk a little bit about, and see what are the problems and how it is that they can reach these institutions to develop partnerships for effective implementation of alternative justice. So that is what the second part is about in terms of building partnerships with the community and with key stakeholders. And as Dr. Burke has outlined, that this could open the challenges with resources. These partnerships could open opportunities for funding. So if it is that there are these alternatives and there are these other stakeholders, then we can think through how there can be alternative funding streams for alternative justice. And of course, we're also thinking of sustainability. So we don't want just partnerships that are not sustainable, but we want partnerships that are long term, MOU, where there are these binding agreements with the centers and communities. So we're talking too about the capacity to address referrals from the JCF, and this is something that is clearly articulated in the restorative justice policy, where there should be a point of intervention at the police station. And this is important as we continue to think how we are developing community policing and other policing mechanisms that are focused on the community. So this we believe is central. So once there is an issue and this gets to the police stations, then there should be a mechanism to say readily what can be done in terms of use of alternative justice. So this, of course, is important. But then there are these organizations that we believe are so important. So we'll start with the first that we have there, the hospital. So the Ministry of Health, they have been working on this injury surveillance system. And early in that manifestation, they would have persons who would be interviewing individuals who would come to the hospitals who had some kind of violent related injury. And this would allow them to understand what precipitated the event, what people are thinking of, like if it is that you have revenge seeking kind of a revenge seeking orientation. So if it is that we have these relationships at the hospital, we'll be able to have another point where we can say, there someone came with, for example, a stab wound, and we see where that person and their loved ones are thinking through revenge. We're seeing evidence of that. Or in our discussion with that individual, we're seeing that there is a potential for escalation. Then there can be that type of intervention. The places of safety, and we have seen where there are reports of challenges within those institutions. So how can the ADR be applied to those institutions? The schools, and this is very interesting, and the potential is just endless, because we see where we're trying to intervene in the problems that we're having at the schools. We're taking a very punitive orientation. So we have, for example, the program with the deans of discipline, we have the guidance counselors, we have the state school officers. We're still seeing these incidents in the school, even where deans of disciplines who are there to help with the safety and security and the whole governance structure of the school, they are being attacked. And so the Ministry of Education has said, we're going to take a zero tolerance approach to this kind of violence. So we want to ensure that we're utilizing ADR in a way that can make our schools safe, where it's not this combative, but we can have these healing circles where we can have those persons that are identified as, well, the literature, they don't like calling them victims, but persons who have been harmed within the environment, really just deconstructing what is happening, being able to link this with what is happening in the communities. So, is it that this person is acting out at school because there is a problem within their home, because there's a problem with the community? And we're not saying by no means that the counseling provided by the guidance counselors are not important, and that all of these discipline and the programs that are offered are not important, and that the police they have invested a lot in the training of these safe school officers, that but there is the mechanism that is about not just attacking the incident, but looking at what is happening to the person who is causing the harm, the person who um, has been harmed, and looking at how it is that we can see what are the different factors feeding into this, and breaking that down and doing the kind of healing that is necessary. Also, the churches are important. These, of course, are important because of the outreach programs that are offered, and the churches really understand, and other faith-based organizations understand uh, the interpersonal problems that the community face because of how they interact with the community. So there's an intimate kind of knowledge about what is happening, and they're also able to see on a macro level what are some of the problems. So they too have the potential to see not only the problems that are manifested, but also potential is, and they are able to be key information sources for referrals. And we are also thinking that other CBOs that might be in the communities, that it is just important for the center managers or the centers to have the capacity to identify these nuanced kind of CBOs interventions that they can develop partnership with. Of course, the JPs are important, and yeah, justice of the peace in also this referral system. One of the things that we think, the research suggests is underutilized, is the potential for ADR to be used in the correctional system. So the restorative justice policy makes allowance for uh, the of use as a part of the rehabilitation reintegration model. And we believe that, of course, this is central because, as was explained yesterday, and I think it was Mr. Cannon that gave a very vivid example, that persons go through the court system and they believe that they have paid their dues to society, and then they just come up. But there was an incident and there is harm. And if it is that we are able, as a part of this reintegration process, to get those incarcerated to deal with the problem before they exit. So you're thinking about contacting, and we see how this can be done in several ways. Contacting the person that was harmed and having some kind of healing process taking place. So once it is that they the institution, there the healing has already taken place, and we can think about how this would help with recidivism, where people, once it is that you're confronting these things, once it is that you're doing the kind of healing that is necessary, then you are able to go back to the community without fear because the issues have already been dealt with. So we believe that, and the greater international best practices have shown that this really is an effective component of the process that really can help in dealing with recidivism and also reducing that potential for reprisal once someone gets out. So this is really the innovative part of the model, and we also believe that there is much potential uh, with the child diversion uh, policy and its inclusion uh, in the whole ADR framework as we think of diverting children from the criminal justice system, the child justice system, uh, and to have these policies, then we can also see how ADR can help with facilitating healing at the community level so that these children that are diverted from the courts have a safe space for their growth and development. Because the whole spirit of that child diversion policy is to get the children to a place where there is some amount of social responsibility and we're able to effectively deal with issues that have been presented. So, so all of this, uh, then of course you have the centers being equipped to engage with the RD and mediation process and to that Dr. Burke spoke about. And the model would go, the case satisfactorily being dealt with. But in the event that there's non-compliance, we would want it to go back to that referral process. And as a last resort, it goes back to the court system. So that is a synopsis of the model as we have it now. And we are really articulating, coming from the research, that there is just this need for focus on the victim of crime. We know that traditional systems tend to focus on the offender and the offense. And we believe that a model that is more focused on the victim will produce these dynamics in the community that are able to create a safe and secure environment for Jamaicans. So this whole alternative justice approach is this non-pathological type of approach that is saying that we value, we are focused on the offense, but what we want is an increased sense of safety, an increased sense of security at the community level, and that we're empowering the community to work through or build systems that create social control where there is not the dependency on the police to respond to every matter, but the police responding to schools, the police responding to everything that is in the community, but that there are these mechanisms that takes in account the nuances of the community, and then this will allow for the building of trust, the building of relationships with the community and state agencies, and the overall strengthening of the governance structures in all communities. So this is the overarching idea of the community justice framework. Thank you.
All right. So that was a very in-depth and interesting presentation from Miss Nicola Sachel. She is a community safety and security specialist. So she spoke to us about the community justice framework specific to the lived realities of the communities served by security and justice practitioners. So I have a few questions for Miss Sachel. It won't be a lot. I have just about 3 questions for her. Right away, people tend to question whether alternative justice programs like restorative justice can be truly restorative in a society based on retributive values like Jamaica. Are you confident that we can shift the cultural understanding or perceptions of justice in Jamaica?
Sorry, a little unclear. So could you repeat the question, please?
So let me repeat the question real quickly. So, based on the retributive practices in Jamaican or society, are you confident that we can shift the cultural understanding or perceptions of justice that we have in Jamaica?
And of course, this is not something that we expect to happen overnight. So, cultural change is always a long term investment. So, but we have to start somewhere. So, as I said before, there is this orientation that violence begets violence, and something happens, and the automatic response is that I want this person to pay. So, one of the cases that we actually looked at when we were developing this model is the case of that lady in St. Thomas who actually beat her daughter with a machete, and persons were calling out initially, how could she have done that? And she would be locked up, and she needs to go to prison. But then we got more information, and persons started to think, oh, this is not just a evil mother. This is someone who might be frustrated with what is happening in her life, that the community could come to her and say, this is how she is, but she is really a mother. And so the approach was different. And the system was able not only to just send her to give her a sentence of time in prison, but to say that there is a need for anger management. There's need to help her to deal with whatever is happening in the family setting. So this is not just one night thing, but it come we understand that there are these various uh, ways in which people are trying to navigate life. And sometimes when things happen, it's not just because someone is evil, but there can be these interventions that will have more long-term impact on safety and security at the level. So we're seeing some of these shifts, and of course it is coming very top down. And what we want from this community framework is to have that more bottom up, for there to be the kind of education that is necessary. One of the things that was said yesterday is really who should be responsible for the kind of education and empowerment uh, around and mobilization around ADR, right? And we believe that all of these agencies at the community level and the peace centers, the restorative justice centers, also have this central role to play, and also that they have the capacity to have these space specific type of intervention that will help with that overall approach to moving from retribution to more alternative justice.
So you mentioned specifically recidivism. Recidivism are convicts going back to prison, as it were. And restorative justice centers, now they have specific roles and functions. How do you, as a community safety and security specialist, see the restorative justice centers as a specific place that can help as it relates to the reduction in recidivism?
Yes, good question. So, as I said, uh, many jurisdictions have this framework where they allow a victim and the offender to, and this, of course, is whether or not they want to participate is voluntary, uh, but have this mechanism where they can work through the issues before the person has completed their sentence. And the restorative justice policy, now as we have it, actually has this as one of the tenants within the policy, tenants within the policy. So if it is that we create that space for dialogue between victims and offenders, and we don't even have to go to murders, rape, which of course is very debated in the literature. But for other kinds of offenses, um, not that it's not possible for all, but yes, where you have an opportunity to meet with the persons that you have done harm to. You're able to do all of these healing circles, and there is this way in which you have worked through the harm that was done. That means when you go in the community, there is already, we've already worked through this. And so its tension is not there. The potential for retribution. So this person's person or persons leaving the institution will feel more comfortable and not going back with this whole confrontation type orientation, but looking at going back to a community that is accepting the individual, where the families can now say it is safe for them to come home, and they're not looking for them to come home, and there is someone out there wanting to harm them and the larger family. So this will help in having the offender being reintegrated in the community and having that relation within the community. And the literature suggests that this will help with recidivism.
Thank you so much. So my final question has to do with the overall presentation from Miss Nicola Sachel, and it has to do with whether or not the restorative justice centers really have a connection with the community. How will that impact how it is they go about executing their role of restorative justice?
So unfortunately, I didn't hear the last part. So could you repeat?
Okay, so I'm saying, how does it impact the amount of involvement or connection to the community? How does it impact how it is they execute their role of restorative justice?
I don't know what is happening. Um, why is it that you're breaking up? So, based on I'm hearing, you're asking about the relationship between the community and restorative justice centers.
Yes, 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 that's it. That's it.
Yeah. So we believe that it is a central component of the model. Without this, the model will not work. So what we have articulated is that the justice and centers, they have a central role in not just interpreting the policy and not just receiving referrals from the court, but also building relationships with community-based institutions, so that there is the kind of trust developed between the institutions and the centers, the community members and the centers. So they see this as a place that they can really run to get these particular services. That when something happens, and we're by no means circumventing the traditional structures that exist, but saying that there should be this safe space where people can go and get some kind of reprieve, and where the community uh, centers can work with the institutions to also develop systems, whether they are hosted in the institutions or at the center, but where these kinds of initiatives can be built so that persons are accessing this service, so that victims of crime or can also feel as if their voice is important. So important, we have the victim support division, and they are doing excellent work. So if it is that we could have systems like this replicated within the community that can deal with domestic violence, that can deal with issues between or among family members. One of the things that we were looking at is even this issue of elder abuse. And I think Nikisha spoke to it yesterday, where it is that you have all of these issues with the elderly, and they are not able to go out as much, and especially in this pandemic. If it is that there are spaces where these issues can be dealt with, where it is that you have, for example, all of these issues around school expulsion. What it is, if there's another model that is less punitive, that is advanced through ADR, through these parts that are developed. So we don't have to see uh, parents taking the school to court about some of these particular things that we've seen about whether or not we should where locks school. We saw in one case where the school accused a child of selling illegal substances, and this is something that ended up in court. So what if it is that we had these facilities within the community that could deal with these matters, that could ventilate them effectively and have these kind of healing processes? This is what is important, to have these healing processes. Then we will have a capacity for social control. We will have the capacity for greater neutrality. We have the capacity to empower our communities to deal with its problems.
Thank you so much. Thank you so much. And those are my questions to Miss Nicola Sachel. Thank you for being with us today. And Nicola Sachel is a community safety and security specialist. I enjoyed that presentation and I learned a lot about restorative justice and how it is that the restorative justice frameworks ought to be specific to the lived realities of the communities that are served by the centers. That was Miss Nicola Sachel. And we're going to keep moving on because we have a presentation coming right now. Right after Miss Nicola, we have another presentation. And for those who are just joining us, this is indeed the UEEU Alternative Justice Initiative. That's a partnership between the University of the West Indies, of course, and the European Union, and it's under the banner of the Department of Government, Institute of Caribbean Studies, and Equality Rights and Justice for All. Now, I'm Sondre Roden. I've been moderating and I'm here with you to introduce our presenter. Our presenter, she presented this morning, but she's back with us again. And I'm speaking of none other than Miss Dr. Olivine Burke. She is going to present on the use of alternative justice techniques in the child diversion policy and in advancing child care in Jamaica. And I repeat that she's presenting on the use of alternative justice techniques in the child diversion policy and in advancing child care in Jamaica. For those who don't know Dr. Olivine Burke, she is the executive director of the Mona Social Services, and she's a lecturer at the University of the West Indies. She has many years of experience in research, and she has gone in depth with her research for this specific topic. And now I turn over to Dr. Burke.
Okay, good morning again, and I am delighted to join you once more. Thank you, sir. Now my next presentation, Child Violence and Alternative Justice System. In 1989, the United Nations declared the United Nations Convention on the Rights of the Child. The leaders of the world all over came together in agreement to recognize that children are separate from adults in their life stage and development. This ran counter to previous thinking that children were the possession of their parents who made all decisions for them. It also disregarded the notion that children were adults in training. They agreed that children had their own rights, and once an individual was below the age of 18, he or she be protected and nurtured physically and psychologically during their childhood to become adults who can contribute positively to life. That's coming from UNESCO. One such area of change in how children are dealt with when they come in conflict with the law was one of the areas that the convention actually addressed. State agencies have been put in place with a mandate to provide children welfare and protection services. This led to discussions on changing how child offenders should be treated. So countries began to adopt alternative approaches. Countries began to adopt alternative approaches to punishment and punitive systems. This is known as child or juvenile diversion. Now, the research that was conducted, which I will be presenting on, will detail the child diversion, child alternative justice systems, and in particular, the child diversion program. Again, as a researcher, we go through the formal system. I'll be presenting to you on the context, the background, the objective that was to be achieved, the methodology that we use, the findings, and of course, again, a SWOT analysis and some recommendations. Now, as I indicated, governments all over the world, they're still grappling with issues of providing justice for all. Countries within Europe have embraced the concept and have introduced legislation, and I'll tell you a little later from how early they have been doing that. And they have introduced legislature, infrastructure, and support systems to provide this justice for all. And justice for all actually include our children. Like in Europe, Jamaica recognized that justice for all was applicable to our local context. So of course we replicated, you reviewed what entails elsewhere, because of course you can't just blanketly put things across systems. So they looked at what was there and replicated a lot of the elements therein, because Jamaica recognized the need to place greater emphasis on the rights of the child, as well as provide a child-friendly alternative justice system. So my objective was to explore the use of child alternative justice systems in Jamaica, particularly the child diversion program, and to make some recommendations for improvement. In terms of the methodology, this is a qualitative study. By a qualitative study, we actually hold conversations, if you may, with the persons to whom we speak, in order that we can get as much information as possible within their own setting, where they're very comfortable, so you get as much of them that would give us information that you would not get within a quantitative research. And the design that is used is an exploratory research design. Primary and secondary data were the main source of collection of the data. And of course, we ensure as researchers that we observed all ethical considerations. Persons were approached, they agreed, they agreed to be a part of the study, they signed the consent form, etc. Now, in terms of the sample, the sample was purposefully selected. We had two focus groups. It was divided between focus group and elite interviews. 6 focus groups were held, as well as 6 elite interviews. Now, 6 communities were also targeted within Kingston, St. Andrew, and Montego Bay. These communities were purposefully selected. They had to fulfill certain criteria, certain characteristics, some of which were they had to be inner city communities, they had to have a justice center or some legal aid within close proximity, and also incidents of high child, family, or individual abuse, but in this case, child abuse. In terms of the focus group and the elite interview, 36 participants were included in the 6 focus group, and of course we observed again from the minimum 5 persons within the focus group to 10. The age range of the persons ran between 18 and over, so we had persons above 60 who were part of the data collection, and we had 21 males and 15 females within the focus group. And for the elite interviews, we had 7 participants, 3 of whom were males and 4 females, and they were all over the age of 34. The instruments that were used, they were self-developed, and we had roughly 22 questions that was focusing on child violence and diversion, and 6 main areas were covered: child law, child crime or children crime, child abuse, and knowledge of the child diversion program as an alternative program within the justice system. 14 European countries were looked at, and 11 countries within the Caribbean. We wanted to ensure that we covered as wide an area as possible. So we looked at places within the east, west, north, and south within in Europe, and also places within the Greater and Lesser Antilles in the Caribbean. So we now look at the countries and their programs as summarized in this graph here. Of the 11 Caribbean countries, 7 of them had child-friendly legislation, 4 did not. The laws were passed that related to children, child diversion, the Child Act. The laws were passed. 2 were passed in 2012. 2 countries had their laws passed. 2018, 2 other countries, and 2019, 2 other countries. Jamaica is one of those that had theirs. The Child Diversion Act passed in 2018. In terms of courts, only 2 of the 11 Caribbean countries had a court, and you will see that in my next table, which is a court specific to children. Jamaica didn't have one. And the child diversion program, an established child diversion program, 7 of the 11 countries had those programs. When we look at the countries and the programs, Trinidad, the programs covered both for Europe and the Caribbean. You will see the European one covered psychosocial treatment, community placement and community services, family group conferences, restorative programs, timed supervision, mentorship, and so on. Jamaica, like Trinidad and other Caribbean countries, had a well-executed mentorship program, as well as their psychosocial program. They also have counseling and community service, and I will touch back on the community service because that is not well known here in Jamaica as part of the services that the children can serve in terms of treating, how you allow them to fulfill their obligations once they come in contact with the law. It's important to note that in Belize there was no form of diversion program. The children are sent to youth prison or state juvenile centers. In terms of the age that children are held accountable across the Caribbean, in Trinidad, which more or less they say is ahead of us in the sense that they do not hold children accountable until criminally responsible until they are 18 years old. And it is at that time that they can actually be imprisoned. In Grenada, Jamaica, and St. Lucia, they can be held criminally responsible from the age of 12, and Barbados 14, Haiti 13. And in terms of being imprisoned, Trinidad, Grenada, and Antigua, they can go to prison at the age of 18. In Jamaica and St. Vincent and the Grenadines, it's between 12 and 14, St. Lucia 14, Haiti 16. And when you look at the European countries, 11 of them, even though these European countries have been around for ages before us, there are still countries out there that do not have a child diversion program. So of the number, 11 have and 1 does not. And the year that their laws began passing was as early as in the 1940s. As you can recall, we started just recently, 2018, thereabout. There are 10 of the 14 countries reviewed, 10 have a juvenile court, 2 didn't. And they have an extensive child diversion program within all the countries. So the countries that were looked at in Europe: Belgium, Croatia, Denmark, Finland, France, Italy, Spain. The age at which they can be held criminally responsible: in Belgium, 18, and imprisoned 18. In Croatia, Germany, Greece, Italy, above 14. But in Switzerland, you see from as early as 12. The Netherlands rarely sentence persons or children to prison. Then in terms of the program that they have, I want to point out that in the Caribbean, I did mention that they had the child diversion program and other alternative programs that are comprehensive. In Europe, you had the HALT program. In the Netherlands, that one is very unique because it caters, well, the program involves the children have to be referred by the police, which is common to what we do here, and it has a full educational and training element in it, like we have here. In the UK, there's a youth inclusion program, and in that program, it is really specific. It targets at-risk youth. Our program doesn't necessarily target only at-risk youth. Yes, because you have children who portray different kinds of antisocial behavior that really don't lead them to being, you wouldn't consider them really at risk. Sometimes some children just unfortunately get themselves in issues and you do not classify those as at risk. But in Europe, their program, the youth inclusion, in the UK, the youth inclusion program specifies at risk, is specific to at-risk children. In Belgium also, there's a protective justice program that is specific again, and that program includes repayment for, incidents that may have happened. Also within Europe, you find that there's a lot of focus in some European countries, Belgium being one of them, on substance abuse being a part of their program. We don't have much of that in our Caribbean programs. Croatia also has that. Now, to the questions, can a child commit a crime? Of the 43 in total respondents, all of them agree that, or indicated that children above 12 years old can commit a crime. One respondent believed that children should be held criminally accountable from as early as 8 years old. Of course, this would be against the law because our law hold them accountable much later. They can't be accused of criminal, intent until 12 to 17 years old. So in justifying the 8 years old, the respondent says that from a child can differentiate between right and wrong, they should be held criminally, or they should be held accountable. From a child reaches 12, he or she is able to do abstract thinking, and as such, they know right from wrong, they know good from bad, so they should be held accountable. To the question, what types of crime can a child commit? The respondents identified a number of the crimes that are included in the Child Diversion Act. Simple crimes including stealing and, robbery, stealing, wounding, and assault. But again, even though wounding/assault comes under petty crime, depending on the extent of that, then it can switch to serious crime. Serious crimes included murder, again, robbery, rape, and other sexual assault. The Child Diversion Act mentioned indecent assault, unlawful wounding, simple larceny, negligent use of fire, noise and disorderly conduct, damage to property, littering, public places, and of course I mentioned sexual assault. Now, quite a number of this, the respondents did not recognize. They weren't aware that these were actually crimes that are considered, or acts that are considered crimes. How should the law treat with children who commit crime? Well, the respondents indicated that serious crime must be dealt with while the law takes control and the persons are held accountable and responsible. The law should at the same time treat these children differently. They are not adults, right? So they should not at any time be considered to be placed in any form of adult facility. One respondent indicated that, I believe if a child commits a crime that, say, warrants detention, they should be held in, so to speak, a juvenile institution. Not too overcrowded either, because we have heard of incidents of overcrowding. Give them room to breathe, to think, because if it is overcrowded, then you would be creating more problem. They should be dealt with separate and apart from adults. No prison for children, regardless of the crime. They need special attention, and so we should be taking that into consideration. When we ask, how should the law treat with the children who commit the crime? They said that 16 years or older should receive the same punishment as adults. So again, we see that it is being consistent with what is in the act, the law. And according to them, repeated offenders should be arrested and sanctioned by the court according to the stipulations by the law. And one respondent said that serious crime that involves assault and death, the individual should be placed in a juvenile facility where they are taught how to move away from criminal behaviors and actions. They feel that it is too early in the life of the children for them to be quote unquote put away for life. When you lock these persons away so early, you are denying them of the right to life, right, and justice, as stipulated under the Child Diversion Act. So the other question was, how then should the state treat with children who come in contact with the law? And the responses including more focus group, respondents stated that the children, let me rephrase that again. The question was, what do they know about how the law treats the children? And so respondents from the focus group stated that the children were placed in adult lockups. Now, this is what they know. This is what comes out of the research. Some indicated that serious crimes, children who committed serious crimes, they were placed in lockup, then they were taken to the court, then to juvenile facility. Some respondents mentioned that they are sent to juvenile court, to juvenile and or rehabilitation centers, while some also mentioned that in addition to that, to being sent to the centers, they also are exposed to social intervention programs. Now, I'm hoping that you're seeing the trend. At first we looked at the programs that were across the Caribbean and Europe, and based on what these persons, the respondents, are saying, we are seeing the consistency in the type of program and also within the process of the child development, the entire child development program. It is consistent. One respondent said that, yes, send them to these places, but it must be based on what he was saying, that he has been able to see a lot of things in his time, and he has been able to listen to a lot of things. And he said that based on what I see and hear in the media and in the communities, sometimes children as young as 13 and 14 who commit serious acts are kept in institutions where adults are. They are often beaten and tortured to talk or to tell what they know by the state or the police. Sometimes even by members of the community, they are beaten. Yes, because you have members who are in the adult prisons. They want to recruit these young juveniles who come amongst them. They will try and get them to do things because they know that the juveniles may not face as much as they would in the law, by the law. And so what I'm saying here is that this person is saying that when these persons are placed where adults are, they are the facilitation. The ground is there where they start preparing them to be even worse than when they first come in to the place. Yeah, they're green grounds, you can use them. And so the system just mar them more. Should children under 18 be sent to prison? Certainly, they are saying. However, the responses vary, right? Some persons say that child offenders who can determine right from wrong, they must be sentenced to serve prison time, but not adult prison. And of course, again, it depends on the seriousness of the crime. Juvenile detention places, those places are not to be considered as the first place for them to go, because there are some issues that can really be talked out if you involve the right persons within the communities. And so before you even think of sending them to some of these state facilities, because some of them are not the best of what they should be and run in contradiction to the law and the act. First time offenders, they say should not should be sent to prison, but with minimum sanction. And some child offenders have to be locked away, some persons say, because of the level of violence they have been exposed to. So in order to save them, sometimes, yes, you really have to take them outside of their space to save them. And so again, the responses were varied. Yes, lock them away. No, don't lock them away. Yes, do it for serious offense. But in all of this, they are saying due consideration is important before you decide to lock them away. Because again, there are advantages and disadvantages to sending the child away. And so, one respondent said that sometimes it's better they are sent away to be rehabilitated, to take them away from the gangs or abusive homes or the communities in which they find themselves getting worse. So you really have to think about a number of factors before you make that determination to send them to any alternative justice program. Another question was, how knowledgeable? What knowledge do you have? What do you know about the child diversion program, which is a specific alternative program now? Unfortunately, majority of the respondents did not know about the child diversion program. Well, yeah, some persons may say it is just 2 years old, more or less, you know. They didn't know. 7 of the, was it approximately 43? 7 persons knew about the program. And those 7 persons were 3 social workers, and two of them were CSJP former employees, and 2 persons were ministry trained. So what we gather from that is that it is the knowledge of the child diversion program, basically more or less for now rests within the, may I say, the developers of the program, and the persons who are supposed to be utilizing or benefiting from the program. They do not know about the child diversion program. They know, I must say, about different alternative program, but not the child diversion program, to be specific. There are some positives that were noted about the child diversion program, and the other alternative justice program. And I may add here that when I recognized that some persons didn't know about the child diversion program, I ventured to explain the whole tenet behind the child diversion program. And so that helped some persons to want to contribute to what they believe would have been positive, assume the positives and negatives and effectiveness of the program. So some of them what I'm giving you is perceptions for those who didn't know about the program, as well as information from those who know. So one person indicated that the child diversion program, based on how it is established, would have provided this deviation from punitive methods, other methods that they say that have been in place, but they are not achieving positive results. But they believe that the child diversion program can achieve those results. They also said that the child diversion program provides support for the homes of the children in the program. And it also provides psychosocial treatment to children and other members in the family. The child diversion program also has the potential, which is the slide just before that one, it has the potential to steer children away from deviant behavior, because as you know, they would be now exposed to, they would be trained through the various treatment program, the psychosocial program, etc., to to adopt or adapt some positive behaviors, attitudes, and stuff. The program also has the potential to provide children with positive mentorship, because that is also one of the areas that the program encompasses. And it also exposes children to counseling as well as mentorship. But they also believe that there is no guarantee that assigning a mentor will create behavioral change in persons. So if the program fails, they are saying, to address core, if it fails to address the root cause of deviant behavior, this could result in recidivism. One respondent said that the developers and mentors are not considering that children who enter the program may not even be clear as to the goals and objectives of the program. Most times when they're placed in these alternative programs, they just see it totally as what they call punishment to deny them certain rights and privileges. And so they're saying that we need to do much more for the children who are placed in these programs, for them to benefit fully. They need to have a clear understanding of the goals and objectives, and the persons must also have the patience to make room for the persons who may not get a full understanding when they are explained to. Now there's a question that says, how can the child diversion program be more effective? Again, different respondents gave different contribution. Persons said that the program needs to be holistic in approach, and of course that's how the program is designed both in Europe and here. Holistic in approach, involving a range of sectors and institutions to meet in order that the implementers can meet their goal. There also needs to be recent knowledge, and whatever is in the program, it must be relevant to the times, which means to know. And some respondents, they do believe that going back to values and attitudes, some of these things, morals that are missing from the society, that the program should involve a religious approach aligned with, of course, these morals, values, and of course, God in mind. So one respondent stated that strategies you use in the 70s, 80s, 90s, they can't be used now, because they're dealing with a different level of persons with different mindset. So you need to come with something new, something different, something strange, something unusual, in order that you can reach these kinds of young people, and for the program to be effective. And also they're saying, especially the very younger ones in the group, are saying that each case must be taken on an individual basis, and that the children must not be stereotyped because of the community we live in or our family background. And this part was very instructive, because I don't know if you call it fortunately or unfortunately, persons within some of the focus groups were actually persons who had quote-unquote benefited or were placed in some of these facilities before. And of course we didn't know, but they were able to provide a clearer understanding for some of us who we're on the outside, we're collecting data, but they were able to put some corrections to some of what we thought happened. One person in particular said that, as a developing country, I know that if we have the resources to populate the kind of intervention that the CDP, Child Development Program, to populate that kind of intervention, I think it would be good. You know, it takes concerted effort, effort that is more focused on educating the children, efforts that are focused on health and other macro sectors, so that we may reduce the number of offenses. So the child development program, yes, if it is to be rolled out in its fullest sense, it will call for a lot of financial injection, but we can do it. How can we reduce child abuse in the homes? Because child abuse in the homes is, boy, it is a sore issue. And I can say, and there should be, even yesterday it was referred to, in inner city communities, child abuse becomes even more prominent in situations like now, within a COVID-19 situation where persons, children and everybody, they have to be home, yes? And so, like in times of crime and violence, whenever there is the upsurge and criminal elements are not able to go out and do what they want to, they turn inside. And so this is when you find different kinds of sexual incidents happening. You know, the child abuse, frustration from parents, a number of persons, as you know, have lost their jobs. And of course, you would naturally take it out on the quote unquote again weakest link, whether it be physical or whichever kind of abuse. And so the child abuse is there. It's our reality, and one that we have to find ways to deal with, especially as I indicated now. But from the research, the question was, how can we reduce child abuse in the home? One person said that the children themselves, they play a very, very important role. They can stop abuse by reporting it to the police. But I remember yesterday also one person, they were talking about the family violence, but it also is relevant to child violence. Reporting it to the police is one, but then where do you go after that? You have to go back home. And so there are issues there, but they say that is a way to reduce child abuse. Another person said they can talk with respected member of the community or church about the abuser, but they should not get the police and the law involved. Again, we see the protective factors of some residents within communities which what they call, help to defeat what we're doing in terms of wanting to reduce crime and violence, because they're saying these things happen, but don't tell the police nor get the law involved. Some persons say start support groups for parents as well as the children, public education campaign, and use social media and animation. This use of the social media and animation ties back to what they were saying about using relevant methods to reach persons who are involved in these kinds of things. And because they know that a lot of persons, young people in particular, utilize a lot of the social media and animation. If you can do your training, your sensitization, through your capacity building through social media and animation, then you will be able to better reach these people. In the voice of one of the respondents, they were saying that this person in particular was saying that she didn't recognize that verbal abuse was so devastating until she grew up and hearing it for herself and seeing how parents deal with children. So verbal and physical abuse, this individual was saying he observed it, he saw it so many times, that many mothers, he said, they do not know how harmful verbal abuse is, and they should be made aware. They need to teach parents how to build trust and rapport with their children, because when you build that rapport, then the children will be able to feel free to talk to the parents, and the parents, on the other hand, will be able to notice any kind of change in behavior that the children or the child is showing, and in that way you will be able to stop some of the abuse, because when you see it, then you can ask some more questions. What is happening? And they will tell you. Teach parents how to be loving and better parents. And I'm saying, when you're hearing this from parents within the inner city, because hugging and showing tenderness and showing kindness, it is not something that a lot of persons were socialized to do. They know that one young lady said that she has never been told by her mother. Well, most of them talk about a mother. There's always most of the time there's no father being spoken about, but was never told that she was loved, right? And so they're saying now to teach persons, teach parents to love, to show love. One person was saying that she has never been hugged by her, and I'm talking about this now, a grandmother has never been hugged by her parents, and she in turn has never hugged her children because she didn't know about that. But now, thank God, she's able to hug her grandchildren, and so we may be seeing some generational change there, because that grandchild would now learn how to hug. How to deal and restore families after abuse. Persons talk about a combination of ways. You can combine counseling as well as the church and what the church says about it. Use a holistic approach. The holistic approach would also involve providing support for the family who, where the incident has happened. Also, you can use the friend and involve friends and other persons who you trust, persons with integrity within the wider community to help to heal and restore. Two persons indicated that, the victim will never be healed, but their behavior can be improved. And when you probed a little more, they were indicating that it's not something that you can pick out of their mentality, out of their consciousness and say, okay, you're healed, so throw it aside. It stays there, yeah? And so it remains, but they are better able to treat with situations because of the treatment that, the psychosocial, psychological, whatever treatment that you take them through. So the respondent said that they will never go back to where they were before, but they can be restored to a state where they can work in an acceptable form and manage in society. And so the alternative program would be able to take them through this process of healing, right? So that they can then operate within the system. One person said that we need to investigate more the background of perpetrators, because the perpetrator may have been abused, and it's like a continuous cycle. It's important to identify root cause. Why are these children, why are they committing assaults, sexual assaults, or killing, or stealing? What's the root cause? Identify it. If the root cause is a malicious one, yeah, they be brought before the law. However, if in investigating you find that the underlying issue is not malicious, then they can participate in treatment program. One person indicated that through restorative justice, and you can actually experience the behavior change. You can have the change in the perpetrator by exposing them through restorative justice. And if you remember what restorative justice is all about, is bringing both perpetrator and victim together, so that they can actually have a conversation, talk it out, and come to some amicable resolve. So you can utilize the restorative justice and get the perpetrator to acknowledge that he or she has caused some form of, the harm, and you educate and train the perpetrator and victims as well on healthy family relationship. And they again say that you educate them through different media. So we looked at then looking at a SWOT analysis of the child diversion program. From the literature and also from some of the respondents who know about the program, there were many strengths. Some of the strengths involved or included that the program involves international component. It is driven by psychological theory. Children are diverted from the formal justice system without acquiring criminal record. Remember that, or maybe I should not say remember, but the child diversion program treat the children within their space, not taking them out and putting them into any facility, yeah? The program also, the children are not exposed to lockups and prison for minor offenses. Children are not separated from their family. There is an international component. The program is holistic, and there are dedicated staff members within the program. In terms of weakness in the program is that, if you recall, of the 40-something persons, only 7 persons, and these are persons who have been exposed to restorative justice and the Ministry of Justice training, that really know about the program. So one of the weaknesses is that community awareness of the program is low. Most groups didn't know clearly either didn't know clearly what the child development program was, but they have knowledge of alternative justice program or alternative programs for children. Another weakness is that there is no restoration or healing process directly for the victim. Also, there is insufficient human resource and monitoring for children in the program. I should mention that a strength of the program is that there are offices all across the country with officers, but again, it's a highly kept secret from the persons who you would want to use the program and the facility. So we have a lot of work to do in terms of creating awareness so that persons can be provided with the various forms of alternative justice programs or systems in place to help in rebuilding children, in help in treating children, not only children but also families. So we provide the opportunity to introduce also pre-diversion program to reach children even before they start getting in, conflict with the law. There's also the opportunity to introduce healing and restorative process directly in the program, because I don't think restorative justice is in the program. There is also the opportunity to expand the family diversion program so that it involves all the family related to the family members related to the conflict. There's also the opportunity to provide facilities for psychosocial assessment, because what we found is that most of the assessment is done at the micro assessment place. One, dates have to be set, you have to wait forever, and it is costly. So if we can, provide another facility, then it would be able to reach more children, because the statistics show that most of the persons right now getting themselves in trouble fall within that youth period. A lot of them within the 12 to even 18 year old. And so if you want to move away from the backlog and also to also reduce all of these child offenses from within the communities, then we have to have the facilities to do so. The threat to the child development program would include change in strategy of the Ministry of Justice. Yeah, they have been going this direction, and with every governmental or whatever change, they may be changing program. That's a threat to the program. So it is important that you relook at what is there very, very early, see what the strengths and the weaknesses are in the program, and also pave the way so that the child development program can achieve the objective for which it was set, for which it was established to achieve under the Act. There is also the threat of reduction in budgetary allocation, and of course the fact that it is only one officer that is placed in each office across the country, then, and all of these cases being brought, then you run the risk of of burnout by the staff. So how can behavior change? And so from the strength, from the SWOT analysis, SCOT analysis, we also had some recommendations, and the recommendations are that you need to launch a post-diversion support service which include group therapy and support network. You need to create a more friendly justice system in all the alternative justice program, because there are quite a number of negatives coming from the program. You need to conduct a review of the convicted children and provide opportunity to expunge records from expunge record services for non-felonies. And that is important, because I have experienced somebody who way in their 50s when they were to be placed in a particular, it was a job, and one of the things that was holding them back was that same record that they thought was expunged. So we need to ensure that that is done. There's also the recommendation to transform SOCA into the child unit of the JCF, to incorporate substance abuse intervention in the treatment plan. I'm not sure if that is in our treatment plan here, but if it is not, to to incorporate it for perpetrators of interpersonal violence, create diversion strategies for child abuse, um, diversion strategies for family violence, child abuse, and intimate violence must include positive parenting and conflict resolution. They believe that parents really are guilty of much of the abuse that our children are facing. Thorough background checks must be done of volunteers and other civil servants that we bring in the system to work with child services and agencies. And this is very important because, you know, there is a financial constraint, so human resource issues issues come around. And, you know, the volunteers are there, you're going to tap into these resources, but let us not just jump on them because then you may just be making things worse. We need to do thorough checks. And also, there's always a recommendation to conduct study to understand the children, the experiences of children who have been arrested and have gone through the court system, and use the information to improve the program. Significantly increase the number of officers, psychologists, and social workers assigned to the child development program. Perhaps that is why many persons don't know about it yet. We need more than one social worker. You know, most of the times you have one social worker for an entire region. They are saying this needs to be increased. Expand alternative justice referral networks to include guidance counselors, justices of the peace, and religious leaders, because we are also seeing the extent to which they are saying that there is the absence of, you know, not enough things on values and morals and attitude in the program. There are times when, yes, you may have to provide some form of stipend. Stipend is much cheaper than providing an entire salary. So, if that is not a part of the child diversion program, then we need to include that. Increase resource allocation to the national parenting program. Increase financial resources to the child alternative justice program. When all of that is in place, then we would really be replicating the kind of alternative justice program that is there internationally and is working. Yes, we may say we're a Caribbean country, but once there is the will, there is the way. Yes, and we have a lot of resources that may not cost us that we can tap into. So again, that brings me to the end, and I thank you for listening again. And of course, I can't go without also thanking the other persons who have assisted Mr. James in this research. If there are any questions, I will gladly take them at this point.
All right, thank you so much, Dr. Olivine Burke. That was a presentation on the use of alternative justice techniques in the child diversion policy and in advancing child care in Jamaica. Yes, I was listening intently. And for those of you just joining us, we're here at the EU Alternative Justice Initiative. I'm the moderator for today, and I'm Sondre Roden. This is under the guidance of the Department of Government, the Institute of Caribbean Studies, and Equal Rights and Justice for All. Now, Dr. Burke, who is the Executive Director of the Mona Social Services and also a lecturer at the University of the West Indies, she gave us an intense presentation just now, and she went in depth based on the research she would have conducted about the entire child diversion policy and how the implementation will work and what's lacking as it relates to the implementation. So my first question to you, Doc, is how do we increase community awareness so that more persons in the community get access to this program?
Okay, thank you for that question. We need to implement a total marketing and public relations program.
Right.
Again, the research indicated that the end users do not know about the program. In the public relations aspect of it and marketing, we need to go in the communities, not stay in the offices. Yes, you talk about part of the findings indicated that we are to use the social media as one of the platforms, but
right.
We also need to bear in mind that not all the persons you want to reach will have access to the social media for reasons.
So then you're saying there needs to be underground marketing.
Underground marketing as well, and that can be very cost effective if you involve some of the agencies that are working, the NGOs that are already established in the communities, as well as the community-based organizations, because a lot of the communities have robust community-based and active community-based organizations. So you utilize them. You utilize the schools, you utilize the churches, you utilize community space. Just open, what I call it, upon the corner, just talk to people. Yes.
Yeah, so for children who need help as it relates to child diversion, the child diversion policy and how it can help children, is it that they can get access to this more than once?
Yes, the program is there for them to access more than once, but they would not know that, and their parents would not know that without the awareness. Yeah. What you find also is that some of the children may be treated, but then they go back home. The home was not treated, so they go back to the same things that they were being treated for, and ultimately they come. That's how you would have the community apathy. You know, they don't believe in the program, and so you have to retreat them. But what's the sense in treating, retreating when you have not yet gone to the root cause and you're only treating one end?
Okay,
so you have to have the real holistic approach, not just by words, but by action.
So in essence, an entire social transformation then? An
entire social transformation of the child, the family, the community.
Right. So is there a fee for this type of child diversion?
That part of it I did not go through. But I would want to think that the assessment, which is costly, I would want to think that there is some fee there, but I'm not sure if that fee is assumed by
the end users.
Yes, or so. But I could find that out.
Okay. So another thing I was thinking about, you spoke a lot about the violence that children would experience in their homes, and you specifically pointed out the matter of reporting it to the police and then nothing happens in a sense. It's a matter of going to the relevant authorities and then going back into the situation, which then poses a problem because even after reporting, there is nothing done. So I've seen in recent times as the talk about shelters in Jamaica. It's both political parties would have been talking about it because of elections and the whole works. And the government now says there are 3 shelters that should be up and running really soon. So my question to you is, based on this child diversion program, is it a case where now there can be a push for children who report these things that happen in their homes to have some type of relocation to one of these facilities so that in times of investigation they can still be taken care of and they don't have to succumb to the activities that might be hurting them in their homes?
Well, under the general alternative program, yes, they can be, after the assessment is done, they can be removed to a place of safety. But and of course, like there are places of safety, the Medcal,
right,
the different ones. But the child diversion program, within the child diversion program, it looks at treating the children while they are in the space.
Okay.
And I expect that at certain point, depending on what is found, yes, they would take them out of the space for their good, yes, and also for the good of the rest of the family.
Right. That's very interesting. Thank you for answering the many questions that we've posed to you, Dr. Burke. You definitely know what you're talking about, your area of expertise. And that, viewers, is our third presentation for this morning. Right now we're going to go for a break. We're going to go for a break for about an hour, and we will be back to finish up. We're going to have another presentation, and then we'll have a panel discussion. That was Dr. Olivine Burke. She is a lecturer and the executive director of Mona Social Services at the University of the West Indies. This is the UE EU initiative as it relates to restorative justice, and we'll be right back after our break.
Mediation. Mediation is a collaborative process that encourages people to communicate freely about problems or disputes.
It makes neighborhoods and towns a safer place to raise families and do business.
Save money
And can be resolved at the local level.
So here we do the right thing and put the past behind you.
Restorative justice gives victims the opportunity to communicate with the offender.
It is not about passing judgments, but repairing harm that has been done.
Restorative justice works.
Yes, everyone has the ability to change.
Restorative justice, a pathway to a more secure Jamaica.
What go on, bro, God?
But there no man. So I'm too fuzzy.
Mama, them not have no money to bail him.
Money? Say no hear about legal aid.
No, sir. What name, sir?
Everyone has the right to justice in the country's justice system, even if them can't afford it. Yes, man. Them provide a private attorney for defend the client. Yes, man. More Jamaicans are now able to approach the court.
Alright, bro. Now say a word. Now go link up mama for go down a legal aid council.
Mediation is a collaborative process that encourages people to communicate freely about problems or disputes.
It makes neighborhoods and towns a safer place to raise families and do business.
Save money
And can be resolved at the local level.
So here we do the right thing and put the past behind you.
Restorative justice gives victims the opportunity to communicate with the offender.
It is not about passing judgments, but repairing harm that has been done.
Restorative justice works.
Yes, everyone has the ability to change.
Restorative justice, a pathway to a more secure Jamaica.
What go on, bro, God?
But there, no man. So I'm too fuzzy.
Mama, them not have no money for bail him.
Money? See, you hear about legal aid?
No, sir. What name, sir?
Everyone has the right to justice in the country's justice system, even if them can't afford it. Yes, man. Them provide a private attorney for defend the client. Yes, man. More Jamaicans are now able to approach the court.
Alright, bro. Now say a word. Now go link up mama for go down a legal aid council.
Mediation is a collaborative process that encourages people to communicate freely about problems or disputes.
It makes neighborhoods and towns a safer place to raise families and do business.
Save money
And can be resolved at the local level.
So here we do the right thing and put the past behind you.
Restorative justice gives victims the opportunity to communicate with the offender.
It is not about passing judgments, but repairing harm that has been done.
Restorative justice works.
Yes, everyone has the ability to change.
Restorative justice, a pathway to a more secure Jamaica.
What go on, bro, God?
But there, no man. So I'm too fuzzy.
Mama, them not have no money for bail him.
Money? See, you hear about legal aid?
No, sir. What name, sir?
Everyone has the right to justice in the country's justice system, even if them can't afford it. Yes, man. Them provide a private attorney for defend the client. Yes, man. More Jamaicans are now able to approach the court.
Alright, bro. Now say a word. Now go link up mama for go down a legal aid council.
Mediation is a collaborative process that encourages people to communicate freely about problems or disputes.
It makes neighborhoods and towns a safer place to raise families and do business.
Save money
And can be resolved at the local level.
So here we do the right thing and put the past behind you.
Restorative justice gives victims the opportunity to communicate with the offender.
It is not about passing judgments, but repairing harm that has been done.
Restorative justice works.
Yes, everyone has the ability to change.
Restorative justice, a pathway to a more secure Jamaica.
What go on, bro, God?
But there ain't no man. So I'm to fuzzy.
Mama, them not have no money for bail him.
Money? Say no hear about legal aid.
No, sir. What name, sir?
Everyone has the right to justice in the country's justice system, even if them can't afford it. Yes, man. Them provide a private attorney for defend the client. Yes, man. More Jamaicans are now able to approach the court.
Alright, bro. Word. Now go link up mama for good on a legal aid council.
Mediation is a collaborative process that encourages people to communicate freely about problems or disputes.
It makes neighborhoods and towns a safer place to raise families and do business.
Save money.
And can be resolved at the local level.
So here we do the right thing and put the past behind you.
Restorative justice gives victims the opportunity to communicate with the offender.
It is not about passing judgments, but repairing harm that has been done.
Restorative justice works.
Yes, everyone has the ability to change.
Restorative justice, a pathway to a more secure Jamaica.
What go on, bro, God?
But there ain't no man. So I'm to fuzzy.
Mama, them not have no money for bail him.
Money? Say no hear about legal aid.
No, sir. What name, sir?
Everyone has the right to justice in the country's justice system, even if them can't afford it. Yes, man. Them provide a private attorney for defend the client. Yes, man. More Jamaicans are now able to approach the court.
Alright, bro. Now say a word. Now go link up mama for good on a legal aid council.
right. Welcome back to our UE Alternative Justice Initiative. We're here. I'm going to ask for some volume. We're here with you, and we have been here since morning. And that means that we have gone through a number of presentations. We would have had two presenters early on this morning. We'd have Dr. Olivine Burke. She did two presentations, and we had Miss Nicola Sachel, and she did a presentation on community justice framework for the lived realities of communities. I am Sondre Roden, and I am moderating today's proceedings, and today's proceedings are brought to you by the University of the West Indies, European Union, under the banner of the Department of Government, the Institute of Caribbean Studies, and Equal Rights and Justice for All. Now, we would have taken a break for just about an hour, and we are back with you, and now we're going to have our fourth presentation of today, and now it's the afternoon segment. We're going to have Mrs. Carol Watson Williams. She's a social research consultant of Rethink Social Development Limited. Social research consultant of Rethink Social Development Limited. Mrs. Watson Williams will be presenting on the role of the UE Alternative Justice Initiative in advancing justice in Jamaica. Lend us your ears, keep tuning in and listen to what Mrs. Williams has to say. Mrs. Watson Williams, I turn over to you.
Thank you very much, Jay, and thank you and the team for inviting me to make this presentation. I must admit that when I was first asked, I was a little hesitant because I wasn't sure that I was the person for this. But I've been working on a justice reform project with the EU, technical assistance, as part of a technical assistance team, looking at several elements in justice reform. Including an assessment of the Justice Reform Implementation Plan that was just concluded. So the plan ran from 2015 to 2020. And another aspect of the technical assistance, which I won't be involved in going forward, is the development of the second phase of the Justice Reform Implementation Plan, which I think should run from 2021 to 2024 or 2025. So 2025, I believe. So I took the opportunity to just reflect on some of the things that we had seen in our assessment of the justice reform, the first phase of the reform implementation plan. And certainly one of the things that we know, having looked at this plan, is that the modern justice systems, and if you look at a lot of the work that was done, even from the 2007 task force, what we know is that the modern justice systems acknowledge that their viability is closely linked to their accessibility. So where we have citizens who feel the justice system is discriminatory or beyond their reach and having little to do with their needs, we know that the very remit of the justice system is undermined in those circumstances. And that is why an access to justice project, such as the one that has been implemented under the Equal Rights and Justice Project, is so very important for an expanded understanding and an expanded experience of the justice system. What we found is that in the first phase of the reform implementation plan, a lot of the activities, although it was cloaked under this general heading of access to justice, a lot of those activities, though, focused on access to justice in the courts. Some of them did not look at access to justice beyond the courts, which of course is what this project is about. I know, though, that the Ministry of Justice is very keen on looking in the next phase of the reform implementation plan, looking at alternate dispute resolution mechanisms, such as, of course, mediation. And you know that they have introduced restorative justice, both the policy and the act, the child diversion, both policy and act, as part of their rollout of this broadened concept of access to justice. So initiatives such as this one that we're looking at today obviously has an important role to play as we look towards even further reform of the justice sector. And I must say, though, that to the credit of the authors of the 2007 Justice Reform Task Force report, they too contemplated this much wider conceptualization of access to justice. So some of the things that were done under your project, under this project, fit. I'm just sort of turning a little bit look at some of my notes on my computer, if you don't mind. But some of the things fit from the task force report fit really very well under the activities that this project has carried out. When we look at things like the whole matter of strengthening public trust and confidence in the system, and we look at the work that this project has been doing, where they looked at, they provided many opportunities to the general public to understand how they can access justice and to share it, to not only share but generate and share information with the public about how they can claim their rights and the various remedies that are available to them if they feel aggrieved under the law. So this project is very important in that sense. Another way in which I find that this project has been, it can help to advance justice in Jamaica is the data that it has generated. So one of the things we know is that up until fairly recently, the justice system had what I think we can accurately describe as a fairly weak evidence base, in the sense that there was very little data that was used to guide reforms and initiatives in the system. We know that that has changed significantly with some work that the courts have done with the introduction of various indicators and the professionalization of court statistics. And so we know that that is ongoing. But what this project has done is to provide a broader database, then a broader data platform on which to contemplate some of the perhaps new or ramped up initiatives in the justice sector. So, for example, the work that the project did on collecting data on both the operation and design of the services available at the Peace and Justice Center, the parish justice centers, was really critical because this whole matter of evaluating and understanding how people are experiencing the implementation of these concepts is very important. And what this project was able to do was to go into the parish justice centers and look at some of the what we would call the disconnect between the concept and the operation, between the policy and the practice in these centers. So it was able to identify, for example, weaknesses in the human resource makeup of staffing of these centers, where you only had one person when in fact for the services to be really smoothly rolled out as conceptualized, you may need 3 or 4 additional persons and that sort of thing. So was able to provide real evidence as to how even the infrastructure and the layout of these centers can affect how people experience the services. And of course, if you're affecting how people experience the services, you're going to affect their satisfaction with the service, their confidence in the service, the likelihood that they will recommend these services, how they see the effectiveness of these services. And we know that for these services to be successful, people have to have faith in them. They have to have the confidence in these services, and they have to trust that these services will respond to their needs. And that is how you help to create a culture that understands that justice is not something that only happens in the confines of the court, that you can have these alternate justice services that meet the needs of the public. The other way in which I think this project plays a role in advancing justice in Jamaica is that it helps us to understand some of the important innovations that can be integrated in the second phase of the Justice Reform Implementation Plan. So there's been some interesting things about the public education around what your rights are, the legal aid services that are available to you, the radio programs that explain to people how to, not only what their rights are, the remedies that are available to them, but how to go about accessing these rights and benefiting from these remedies. You've had the use of television, short documentaries, those sorts of things. Those are innovations in a very conservative system, in what has traditionally been a very conservative system. And I think we have all seen a nod towards modernization in the justice sector. And we hope that with this sort of active community involvement and the involvement of non-state actors in building confidence in the justice sector and building another effective, I don't know if I want to say another effective arm, but the potential of what I call justice adjacent services, then we see how these sorts of innovations can help to support the work that is being done in access to justice. And they're important because the more effective these services are, the more they can help to make the court services more effective as well, by reducing the backlog of cases that actually go into the court, by helping people understand that there are other means of settling disputes and accessing remedies. And together, all of that helps with the overall efficiency of the justice system. And one of the things that we hear a lot about is this thing called timely justice outcomes. And what we understand and what a project like this helps us to even more understand is how important it is to have all parts of the system well articulated and working together to create this idea of time justice outcome and to build public trust and confidence in the justice system. The project has also done quite a bit of training activity. It has done training activities in restorative justice. It has done work in child diversion, the sorts of services that are being rolled out and ultimately would be, I'm going to say, fully operationalized, because we know that although the parish justice centers exist, from our own assessment of the work of these justice centers by the admission of persons who work in the Ministry of Justice, and by what we know that they're not functioning optimally yet. So we know that some of them aren't appropriately located, and there maybe have to be efforts to relocate them, to build them out into more facilities that are more purpose built, that will allow the privacy, the confidentiality, and all those things. But that is a process that has to be an important part of the second phase of the reform implementation plan. And but the real point I was making before I got there, though, was about the training that had been done. And every reform effort must be predicated on some effort to build capacity in the system. Because if you're introducing new things, then obviously you have to expand capacity to be able to roll out those things and make them effective. So things like restorative justice, we know that there's been quite a bit of training done by the Justice Training Institute, by the Ministry of Justice, and of course by this project, of persons in restorative justice skills, and to help them to understand their own role in bringing parties together to to arrive at settlements that are both, that are mutually advantageous. So what it would be great to see coming out of this project is if the various training programs that have been developed are institutionalized in as part of the justice sector training agenda broadly. And wherever they're located, if they're located in the Justice Training Institute, if some are located in the Department of Government and University, some are located at Northern Manley Law School, wherever they're located, that they become a part of the training system, and that will allow for persons, for a constant, flow of qualified and skilled persons into these parish justice centers to provide these services. So we know that that is a very important gap that we still have, despite the training that has happened. And so this project and all the materials and knowledge that it has developed can play an important part in that. Another important aspect of this project that I have been particularly pleased with is the attempt to bridge the gap between what many see as an esoteric legal system and the understanding of Jamaican citizens. So lawyers have a way of talking about lay people and lawyers, but the truth is that every citizen who enjoys constitutional protection and the protection of our general legal system has a right to know what those rights are, though that knowledge should not reside only in particular arms of society or particular professions, which is not to say that we're going to, I'm suggesting that everybody will be able to have legal knowledge at the same level. Obviously, lawyers and persons with legal expertise remain critical to the system, but it is also important that I understand that if I am fired for X reason, that might be a breach of rights or some legal protection that I enjoy under the law. And the more people understand what protections they have, the more they feel valued and a part of a society that they feel will take care of them. And that if their protections are breached, they have ways and means, which is within their grasp, not well beyond them, but you have to go and hire a lawyer. A lot of people don't pursue breaches of their rights or the protection offered to them under law because they don't feel that they can. They don't think they have the resources to do so. They don't know where to start. They don't think that they're supported in this. And one of the things that I see this project doing is helping people to understand how they are fully integrated in the legal system and how the legal system exists for their benefit, and how, if that system is going to function to their benefit, how they can approach it, the various pathways that are available to them, legal aid, restorative justice, so on and so, mediation, and for commercial contracts and so on, arbitration, that sort of thing. But people need to know what those pathways are. And more importantly, they need to be supported along those pathways. And as far as possible, the roadblocks to access are leveled, removed, minimized, however, wherever we are on the scale, because sometimes rights is about progressive realization. So whereas you'd want to ensure full protection and fulfillment of the rights immediately, sometimes societies don't have the resources to do so immediately, but we can do so progressively. And these sorts of activities will help us to do so progressively. So over time, if you look at how we've been moving from the 2007 assessment and the different activities that have been implemented coming out of that task force report, where the system is nowhere near complete with the implementation of some of those really, when I reflect on them, that was 13 years ago, and they remain so relevant now. And you can see them remaining relevant for some time in the future. You would call them, some of them really visionary. um, activities that were recommended under that plan. And activities such as this Equal Rights and Justice Program, I think, can only bode well for the advancement of justice because, as I've said, it helps people to understand where they are located in the justice system, how the justice system exists to serve them, the pathways that they can use to access their own rights, claims, and their own remedies. And one of the important things about this, another important thing about this project, was that it opened up multiple avenues to for people to expand access to justice or to help people to understand how they can access justice and share information. So you had community meetings, you had different kinds of activities to bring in different stakeholders and to get them to understand what their role is in this system. So I think overall, this project has the ability. I'm not quite sure what the plan is for the project going forward, but what I would definitely say is that coming out of this project, certainly some of the key lessons learned, and I suppose you have been talking about them over the 2 days that you have been in conference, should be documented and a formal submission made to the Ministry of Justice for consideration in the second phase of inclusion in the second phase of the Justice Reform Implementation Plan, which is being developed now. So we should ensure that the opportunity isn't lost to say this worked, and we think that this is something that when you begin looking at your expanded alternate dispute resolution systems, that this should be included, and so on. The whole notion of the positioning and the role and responsibility of non-state actors in the justice sector is something that Jamaica is fairly new to Jamaica. And it is something that our justice system and our system of laws doesn't really recognize yet, but it doesn't mean that in another 5 years, 10 years, 3 years, depending on what the motivations are, that we cannot fully or provide some sort of local standing to non-state actors in the justice sector. And this sort of exploratory project and the activities that have taken place under this project, I think, helps us to develop a deeper understanding as to how that can be done, and may provide practical information as to how the experiences that you've had on this project can be institutionalized and used to support overall justice reform in the long run. So that's my bit of assessment and part encouragement to the team, as you look to what happens now with the work that you have invested in and you've committed your time to. Thank you. Andre?
Hearing me clearly? Okay, you're hearing me clearly now. Yes, so for those joining now, I am Sondre Roden, moderator for this day of our EU UE initiative as it relates to restorative justice. Now, I have a question for you, Mrs. Williams. Based on your evaluation, what kind of personnel is essential to the day-to-day running of the justice centers once they're fully established? I'm asking, based on human resources, what kind of personnel would be necessary for running these centers effectively?
Was that a question for me, or was it
For you.
a comment?
For you.
I hear.
She's not hearing me clearly. Yes, I'm going to ask you again. Are you hearing me a little better? Okay, I think they're trying to fix that with the technical team.
That was a little better.
Okay, so I'm asking, what kind of personnel do you think is necessary to help as it relates to the justice centers once they're set up?
You're asking, are you asking about staffing? For
Staffing,
centers?
yes.
Okay, great. I picked that up. Well, obviously the justice centers are understaffed. The project itself has been to the justice centers. You'll see that some of them have one or two members of staff trying to provide a whole suite of services, and that obviously that is unsustainable, and that is something that has to be addressed. I know the ministry has done work to recruit additional persons, the staff members in the centers, and that has to be an ongoing effort, because from what my information accords very much with what you also observe in the centers, which is that if you have one person in the center, sometimes the center has to close if that one person has to accompany somebody to court or to do something administrative in support of the services that they offer. So it is going to be critical to staff those parish centers. And you know why it is critical as well? It is critical because there is nothing worse than claiming to offer a service and doing it badly. That is a sure recipe to ensure that people will have no confidence in these justice centers. And if you want to build the confidence that is necessary to accomplish the outcomes that we want, you have to have the staffing. Because it makes no sense for me to turn up at the justice center and I have a same or worse experience than I would have had I gone to court. So that matter of staffing is something that the ministry will obviously have to look at. Staffing and infrastructure, because as we know, as we've said, in some of the infrastructure, definitely inadequate, definitely inappropriate, doesn't provide enough space for privacy, for counseling, for that sort of interaction. So there is definitely a lot of foundation work that remains to be done to make these parish justice centers what they are conceived to be.
All right. Thank you so much, Mrs. Carol Watson Williams, who is Social Research Consultant of Rethink Social Development Limited. She presented to us on the role of the UAEU Alternative Justice Initiative in advancing justice in Jamaica. Thank you so much, Mrs. Watson Williams. Your presentation was indeed in depth, and I even learned a lot from it. So I hope our viewers are tuning in, are learning, are engaging. And we're going to continue along this line, and we're going to go into another interesting part of our day. We're going to have the launch of the Jamaica Association for Mediators Limited. So we're going to that right now, viewers, and we thank you, Miss Watson Williams. Yes, thank you. Have a good rest of your day. And now joining me, we'll have 4 persons joining me, right? And this is interesting because we're going to have a launch. The Jamaica Association for Mediators Limited. I'm going to ask them to introduce themselves, but I do have their names right here with me, so I hope I get it right. I hope my pronunciation is right. I have Miss Terry Ranglin, I have Mr. Burchell James, I have Miss Kevel Campbell, and okay, you see, I got something wrong there. It's Mr. Kevel Campbell, correct? Yes, and Miss Vivette Miller. You see, sometimes you get the wrong information, but they're here with me, and the beauty of it is I'm going to allow them to introduce themselves, and then we'll learn more about the Jamaica Association for Mediators Limited. I'm going to start with the beautiful lady that's on the other side of all the way over on the other side of me. So we're going to start all the way over there. So these are all directors of the Jamaica Association for Mediators Limited. Am I correct? Yes, I am. Go ahead.
Good afternoon. I am Vivette Miller. I'm a mediator. I've been a mediator since 2010, the parish court level, and 2013 at the Supreme Court level. And as was mentioned, I'm a director of the newly formed Jamaica Association of Mediators Limited.
All right. So we're just going to continue along.
Good afternoon. Hi, good afternoon.
Yeah, man, go ahead.
My name is Burchell James. I'm a director of the Jamaica Association of Mediators Limited. I'm a mediator. I've been involved since 2011, and I'm a trainer.
Yeah.
One of those international trainers. I'm involved in the training program for the Ministry of Justice, training Justice of the Peace island-wide.
Right.
And I move over to Terry.
Okay, go ahead, Miss Terry.
My name is Terry Ranglin. I have been a mediator I have been a mediator from way back around 1995. I've had a long experience from the early days when mediation was introduced in Jamaica. So I was on board from very early.
Okay.
And my training experience, that is my experience as a trainer in mediation, also began from those early days in small ways. So I benefited from all that was offered in terms of training and practice. So I'm very seasoned as a mediator, both at the parish court and the Supreme Court level, and as a trainer.
Right, so over to Mr. Campbell.
My name is Kevin Campbell. I'm a Supreme Court mediator. I've been in the practice for past 8 years. I am a practitioner in the area of conflict management as well. It's one of those areas that we have so much to handle, conflict management, conflict resolution. I am a director of this organization, an organization that's been long in coming.
Okay.
It's here now, and we're looking forward to do great work.
All right, so I have a question for each. So I'm just going to start with you, Mr. Campbell. So this organization, you say it should have long been formed, but when exactly did you come up with forming the organization? Because many years you'd have had mediators coming in, but now you thought it was the best time to do it. So what pushed you to form the organization at this specific time?
The mediators have been agitating for a while. The question has been asked so many times, right, Burchell? Yeah. Why isn't there this kind of structure? Why isn't there a Jamaica Association for Mediators? So even the very name come as a result of just the question that is asked. And so we thought to ourselves, the time is now, because with all the other movements that's happening in the country as it relates to ADR, and mediation is playing such an important role in the business of handling disputes. We thought that it is now. And so a few months back we sat down and bring everything together and had the players come on board, those who want to step up and make it happen. And so we got incorporated. So we're babies. Just what, Burchell? A month ago?
Yes, less than a month ago.
Yeah, less than a month ago we got incorporated.
Okay, viewers, don't be confused. They are not babies, but the organization is young, and they're saying to us that, listen, this organization has long been coming and now it's here and they're happy about it. So I'm just going to go over to Ms. Ranglin to ask about the objectives now of the Jamaica Association of Mediators Limited. What are some of the objectives? What are you guys going to achieve, seeing that it's now formed?
Alright, so our objectives basically, some of our main objectives: to provide a medium through which all mediators can be in contact, to be in touch, to engage our members. and to provide a medium through which we can engage the members and also engage other stakeholders, funders, the government, all stakeholders who have an interest in dispute resolution. So, right, so we are that platform.
Okay, interesting. We're going over to Mr. James. We're going over to Mr. James, and we're going to ask a very important question, and it's why? Why no? Why is the Jamaica Association for Mediators Limited important to the Jamaican society?
Thanks very much. As Terry said, and Kevin before me, the need for it was evident long ago. The question is, how do we get it going? I think there was a confluence of a number of issues. One, the backlog in the courts. Two, the need within communities to resolve issues outside of courts. And just the objectives, the general direction of the government and the global community. So we are here operating within the CARICOM framework. And CARICOM contemplated if a situation where all member states would have been using ADR to resolve socioeconomic issues and to impact positively the crime situation. Now, our crime situation, we're among the top 5 in terms of murder in the world, and that's a serious situation. Now, we are looking to see how this can be used to reduce the backlog in the court, reduce the tension in the community. And so the whole question of now being the right time, because both funders, government, and other stakeholders feel that we need to collaborate. And that is what has brought it about.
Okay, so we're going over to Ms. Miller to ask how exactly has the Jamaica Association for Mediators Limited benefited from this EU Restorative Justice Program?
Well, we've been benefited because we are being offered or provided with a platform to achieve our objectives.
All right.
So with a website and all the support that goes with that, this will make everything possible. And as you know, that is not cheap nowadays, and we don't have the technical savvy to do that. So facilitating the process is very important. Being able to have people, stakeholders come on, be able to access, via internet, and especially, with COVID, it has brought to the fore all this technology. So this is a good time, right, to be doing this and being able to go on and do that in the right way. And we will be collaborating to make sure that it is done in a way that facilitates us best. And they'll be there to help us improve it along the way. We're getting support for at least a year. So this will really help us to achieve our goals.
Right. I love to hear it. I love to hear achieving goals. And an organization achieving goals is an organization that we have to look out for. So I want to pose a general question. I think all of you can answer in your own different, unique way. I'll start with you, Mr. Campbell. How do you think moving forward over this year with starting the organization, receiving funding and platforms to do what you ought to do, how will the society benefit? It's a question for everyone, but I'm just going to start and we just take it around the panel.
Let me start with the one that is always out there. It always confronts us as mediators, as a trainer. I cover all the parishes, and the question is always there. How come there is no central place that I can go to gather all the information I need to know about what mediation is? And to look for persons. Independent of, say, the Supreme Court roster or the Parish Court roster, the education needs to happen. People have said, this is the first time I'm hearing about this. And I make it my point. Whenever it is I have an audience, I ask, who has heard about mediation? And most times, I'm surprised how few hands go up. So it says that we have work to do. And so now we have this platform, as Ms. Miller just said, so we can educate the public. You don't now have to think, boy, trepidation about going to court to resolve issues. No, there is a platform in which you can go seek information about mediation. So educating the public is one of the big plus of having this in place.
Okay, Ms. Ranglin?
So, I don't think anyone has to ask at this stage where all of us in the world, where the COVID-19 has placed us in a situation where we have to think about how do we all survive with the work we do.
Yeah.
And so I think this is extremely timely that we are being provided with this opportunity as the Jamaica Mediators, the Association of Mediators, to have a website, to have a platform where we can engage, we can do mediations, we can provide development for our members. And if we look at what is happening globally, I mean, this would catapult the work that we are all engaged in advancing. Mediation is what's called an alternative method of resolving dispute in some alternative, appropriate. It's one of the approaches. So we don't have to ask that this is timely. This is a wonderful opportunity for us to catapult the work forward that we're about.
All right, Mr. James.
Just to follow up, the whole matter of collaboration.
Yeah.
Collaboration locally among mediators. It provides training. It will allow us to interact with our regional partners. It will allow us to look at global best practice and implement it here. But it also can position us for Jamaica to become a global mediation center, because cross-border mediation is possible. And with that platform, we are able to interact with persons globally. And so we want to build on that. And leave the other one clear.
I mean, my colleagues have said a lot. I don't know if there's much more to add, but I will just, you just can't say enough about having that access at the touch of a button, right? And just...
Since you probably don't have as much to add as your colleagues, I have a very interesting question that has been bothering my mind here. I'm looking at this banner and I see mediate, don't litigate. So I just want you to clear up to the viewers, what exactly does that mean? How did you come up with that tagline, mediate, don't litigate? Because interestingly, and you guys said it all, a lot of people don't know. A lot of people don't know. I would have known based on reading and research and all, but a lot of people don't know. Like I said to somebody, in my community, there's a whole center for mediation. They were like, what? I was like, yes, but the people don't really know. The people don't really use it. So, when you say mediate, don't litigate, people might be like, what do you mean? Jamaica mediation? Strange.
Okay. So, well, just for disclosure, I'm also an attorney at law. Right? So I'm an attorney and a mediator. So to explain this mediate, don't litigate, it's saying before thinking of going to the courts, there are other ways to try and resolve problems. And it's not even just problems that you would there are some matters that people don't even think is of court value, right? It could be just they need some assistance to work out their issues. I don't want to call them problems. And so this information that they receive regarding mediation, a mediator can assist you in this regard. So you don't necessarily have to go straight to litigation, or you want to avoid litigation if you can, right? It can be costly, it can be time consuming. It sometimes can be a little contentious. And it is the lawyers who probably dictate a bit more in the courtroom. In mediation, people get to attack their problems on their own terms with an unbiased party, and it's not counseling, right? So it is a way to try and mediate, stay out of the courtroom, right?
All right, all right.
Wait,
So
hold on. Let me put a disclaimer as a lawyer. I'm not saying, not trying to get lawyers out of a job, but we have a lot of backlog, but at least it will, maintain focus. There's some matters that don't need to go that far.
yeah, before I come to Mr. Campbell, since all our presentations since this morning coming down to this launch of the JAM, we've been talking about the backlog in court cases and how a lot of petty cases are in the courts that could be solved through mediation and through mediators. And I think based on this organization, we can see a reduction in the amount of cases that might be petty cases if it's a case where members of the society have a knowledge, have an understanding, it's marketed effectively and people know that, listen, because him owe me 10 grand, I don't necessarily have to go and say I'm going to file a lawsuit for the 10 grand that this man owe me, when it's a simple case that the mediators probably could deal with and they could come to an amicable solution. But Mr. Campbell?
You are correct on that. I just wanted to support Vivet's point just now. This is how important it is, that which you just asked, and that's an excellent observation. Picture this, you're in mediation, attorneys are there with the parties in dispute. The attorneys quickly recognize that what the issue is about, what the contention is about, they really don't need to be in the mediation. I've had attorneys who excuse themselves. They just confer and say, let's step out. We see where you can take this here. So that's how important it is to try to have a conversation first. So mediate before you litigate. Because oftentimes we just didn't see things from each other's perspective.
Wow, I see Mr. James over there.
Add to it.
Right.
You said there are petty things that could be taken out. There are also very complex things in court that requires details.
You see, you're teaching me now,
right. So there are things that require expert.
Yeah.
And the courts are not always able to give it the adequate time and attention. The other thing is that the matter that brings the parties to court is not necessarily the real issues. And so while the court will deal with the issues that are brought before them, the underlying issues are not dealt with, so they go back to the community and they're going to come again because the real issue has not been dealt with. Mediation allows that. It allows for them to resolve it and build relationship. And that is what is key, building the relationship between the contending parties.
Wow.
And to add to that, as you said, this is where the partnership of all is valuable, because it's good for everyone to know both perspectives. Because unless when you know the benefit of, your legal option, the mediation option, or what you can achieve there, and then you can make proper decisions, have proper discussions. Because some people go into court not really knowing what their options are. They assume, right? And so getting the different perspectives and the different advice also helps. So that's why everyone needs to work together, and where this association can help with the information regarding mediation to support whatever else is out there.
Right. So I'm on to my last question. This is a very personal one, though. So I'm going to start from you, and then we come all the way around starting with Miss Miller. So you guys are all directors of the Jamaica Association for Mediators Limited, and because you guys are all directors, you probably have something specific that you want to see achieved through this organization. So I'm giving you your last pitch personally to say, listen, this is something I see that I personally would like to see this association achieve over the timeline as we move forward. So starting with you, Miss Miller.
Is my mic on? Okay. The main thing for me is really to get the information out there, both for the general population and for mediations, because there are some mediators practicing who are not as aware of global practices of the exchange and just growth, right, on both ends. So for persons who are coming to mediation and those who are mediators, to see what is possible.
Okay, Mr. James.
Mediation can have such an impact on our community and nationally that through the association we'd want to see the use of mediation more widespread in all the corners of the country. And so we want to ensure the personnel are there.
All right. Mr. Anglin.
And I will add that mediation involves a set of skills that people have to learn. It's not something that you just know how to do. So that's why we have training, first of all, and we have established a level of competence. So this association, I feel, can help to advocate for those standards, can nurture mediators who need the practice to develop the level of competence required. And in so doing, I feel that in the long run, this association will, in fact, have the kind of skilled personnel out there who can help to resolve disputes, really resolve disputes, and hence reduce the large issue that we have nationally of dealing with each other. The interpersonal, the dispute resolution is about the fact that we do not know how to engage each other in peaceful ways. So this is the work of mediators, and I feel therefore that any support at all that this body can make use of will in fact enhance the skill of members and will in fact help us to resolve or will enhance our ability nationally to resolve disputes in more peaceful ways.
All right, thank you so much. Mr. Campbell?
Thank you. You know, as a practitioner, as a trainer of mediators, one of the things that I've always said, when you have this skill set of a mediator, your entire life changes. You don't see the picture the same way as you did before a mediation training. I'll bring the point home with this. I've had persons who was going through the course, and this course would be a 40-hour training spread over, say, a week.
Okay.
On about, say, day 3 of a training, a participant would come back and say, look, my partner is here to meet you because apparently there's been changes that he or she has seen in the 3 days, and they want to know and see what's been happening and who is causing such change in my husband or wife. Because mediation is not just some text on a paper or you learn a few skills. It becomes you. Your life changes when you are a true mediation practitioner. Thank you.
Wow, thank you so much. Thank you so much. Sadly, viewers, I'm actually out of time, but I got everybody to put in their last bit just at the end, so I think I did well there. But that for you was the launch of the Jamaica Association of Mediators Limited, and I want to remind you their tagline is mediate, don't litigate. I'm not putting lawyers out of a job now because the attorney told me that she's not putting lawyers out of a job, but there are matters that you can bring to mediators that can easily be solved. And on a serious note, we have spoken about restorative justice and the need for it in our society, specifically Jamaica overall. Our society has retributive practices overall. You know, you grow up and you see people just tend to be violent. People tend to want to react instead of having these type of mechanisms. And if these things are implemented in our societies at the very core levels, at our community levels, it would be better for our society, for our children, for our young people, for even our adults and older folks. So I just like to thank each and every member of the Jamaica Association of Mediators Limited. We have Miss Terry Ranglin, we have Mr. Burchell James, we have Mr. Kevin Campbell, and over there, the attorney at law who is not putting lawyers out of a job, Miss Vivette Miller. Thank you guys for being with me. Now, we've come to the end of our EU Alternative Justice Initiative. We've come to the end today, and as I said before, it's put on by the University of the West Indies in partnership with the European Union under the banner of the Department of Government, Institute of Caribbean Studies, and equal rights and justice for all. Equal rights and justice for all. I got that right? So it's the Department of Government, Institute of Caribbean Studies, and equal rights and justice for all. I am Sondre Roden, and it was indeed a pleasure sharing with you guys, and I hope that for those watching this program afterwards, that you would get the relevant information, the requisite information. We'd have spoken about a lot of things. This morning we would have had Dr. Olivine Burke. She gave 2 presentations. We had Miss Nicola Sachel, who is also a community safety and security specialist. She spoke about the lived realities of communities and how it is restorative justice can help in these things. And just a little while ago, we had Mrs. Carol Watson Williams, who is a social research consultant, who told us a little bit more of how the Alternative Justice Initiative would help in society, in our Jamaican society. Thank you so much for joining us. Thank you so much for tuning in. And that's it for today for our EU Restorative Justice Initiative. I'm Sondra Roden, and have a good rest of your day.